Namaskar. Good evening to everybody. Respected Professor Modern Thangabalaji, respected Professor V.K. Agnihotriji, respected Dr. Pawan Kumar Sharmaji, distinguished guests, eminent speaker. I welcome all of you, distinguished guests, ladies and gentlemen, and eminent speaker to this evening webinar on Charak Jayanti Mahotsav. We have very nice eminent speakers are there today. So I welcome all the eminent speakers, distinguished guests, ladies and gentlemen, to this evening webinar. Namaskar. Thank you. Over to Pawanji.
Thank you very much, sir. Thank you very much. मैं इनिशियल वर्ड्स थ्रू मदन सर के, उसके बाद आज का मॉडरेशन पूरा राम तीर्थ जी को देना चाहता हूं। मैं राम तीर्थ जी का साहित्यिक मॉडरेशन का फैन हूं। राम तीर्थ जी, हरिओम। मदन सर,
बहुत बहुत धन्यवाद सर।
राम तीर्थ जी, नमस्कार, प्रणाम जी।
प्रणाम सर, प्रणाम।
बहुत बहुत धन्यवाद for joining us. कल हमारे साथ थे, so yesterday we had several speakers and we had a wonderful discussion. वो उसमें शर्मा जी थे हमारे साथ, सीपी शर्मा जी, और काफी लोग थे। और प्रेजेंटेशंस के बाद जो डिस्कशन हुआ उसमें एक सवाल उठा कि is there a need for how to train undergraduates in Ayurveda? And हमारे साथ थे Ramadas ji. You will see all this in our recordings. And Ramadas ji's comment is that there is a need for a major shift in how we approach Ayurveda for the 21st, 22nd century. We want to thank Pawan ji for bringing us all together in this context of Charaka Samhita, which will remain a textbook for, it has been a textbook for millennia, it will remain a textbook for millennia to come, because whenever I look at it, the information there is futuristic. आज चर्चा चल रहे थे चेन्नई में इंद्रिय स्थान के ऊपर, and there is still so much to be discovered in these texts. And today's two speakers, we welcome both of you to our presentation today, and we look forward to learning from you. Before I hand over to Ram Tirth ji, I want to thank Parul ji here with us. Parul ji, pranam ji. और हमारे साथ है काफी
प्रणाम सर, गुड इवनिंग एवरीबॉडी।
प्रणाम जी, प्रणाम। तेजिंदर जी है देहरादून से। तेजिंदर जी नमस्कार, थैंक यू फॉर जॉइनिंग अस। और तपन कुमार जी है गुजरात से। नमस्कार, प्रणाम जी, बहुत बहुत धन्यवाद फॉर जॉइनिंग अस टुडे। I think you have joined us for a special reason. आपसे सुने discussion time पे कि you have come today for a special reason. So we will leave this now to our moderator today, Ram Tirth
Sharma ji.
Ram Tirth ji, नमस्कार। और आप हमारे साथ है जी रामपाल सोमानी जी। प्रणाम जी, रामपाल जी, प्रणाम।
क्या करना क्या है पवन सर, आगे हो?
हाँ जी, आप
कॉल करें स्पीकर को।
जो सुनो ना, वो तो कर लेंगे, वो तो लिखा है। पहले तो हम आपके विचारोत्तेजक विचार सुनना चाहते हैं कि जिस कारण से हम लोगों ने ये 15 दिन का यज्ञ शुरू किया।
रामदेव जी, अगर हमारी तरफ से एक छोटा सा बताएं जी। हमारे साथ
मेरा निवेदन ये है सर कि रात को 11 बज जाते हैं आप लोगों को, तो ज्यादा बेटर ये है कि दोनों स्पीकर्स को सुने। और विचार तो हमारे पता ही है आपको क्या है कि चरक के ऊपर ये अपन ने कार्यक्रम किया है 15 दिन का।
ऐसे नहीं, भागने से काम नहीं चलेगा। ना 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 ना, अरे वाह, फिर तो चरक संहिता बन गई। महोत्सव ऐसे बनाए जाते। वो तो हमारे अतिथि वक्ता तो केवल अतिथि के रूप में आते हैं। तिथि से आने वाले हम सब लोग हैं, इसलिए ऐसे नहीं बनेगी बात। ना ना ना, ये अपना अच्छा। फिर तो कोई जरूरत ही नहीं थी चक्रपाणी जी की और किसी की भी टीका टिप्पणी की। आपके विचार चाहिए, ये समझ लीजिए, और सबके विचारों का मंथन करने के लिए आप बिठाए गए हैं।
रामतीर्थ जी, हो सकता है कि आज की चर्चा 12 बजे तक चले, पता ये नहीं पता।
अमृत महोत्सव मना रहे हैं। रात्र को 12 बजे ही आजादी मिली थी आज।
रामतीर्थ जी, कल हमारे साथ थे फर्स्ट ईयर स्टूडेंट विष्णुप्रिया जी की गोवा से। अब उनकी बच्चों की तरफ से ये है कि आप लोग बना लिया करिकुलम और उसमें से क्या समझे, वी आर फ्रेश।
सर ये सब डिस्कशन में हो जाएगा सर।
सो आई विल जस्ट गिव दिस
डिस्कशन में कर लेंगे हम।
हाँ जी, हाँ जी, हाँ जी
जी प्लीज रामतीर्थ जी, you can call the speakers. Both are the young speakers today from South region. Thank you to Dr. Ramdas. Thank you, Ramdas ji. Thank you very much for recommending such nice speakers.
मेरा निवेदन ये है सर कि अभी थोड़ा सा मैं अभी उसकी विचार की भावभूमि में आ जाऊंगा। एक बार डॉक्टर प्रियदा को अपन सुन लेते हैं पहले एक बार। उनको सुनने के बाद फिर बीच में मैं अपना विषय रख दूंगा, 10-5 मिनट का जो भी मैं रख पाऊंगा।
बुलाइए प्लीज बुलाइए।
मैं I would like to invite Dr. Priyada ma'am, and she is very renowned laureate and literate person in the Ayurveda field, and it is our happiness to welcome her in this webinar, the Charak of Legacy of the Charak, at the occasion of the Azadi Ka Amrit Mahotsav. Please welcome and clap to Dr. Priyada ma'am. All welcome to Dr. Priyada. Please welcome ma'am, please.
Thank you, sir. Good evening. Good evening, respected dignitaries. Sir, am I audible?
Yes. Good audible.
Okay.
Good audible.
Good evening, respected dignitaries. Myself, Dr. Priyada KV, research fellow from Amrita Center for Advanced Research in Ayurveda, Amrita School of Ayurveda. I am here to present on the topic, the concept of Samvada in Charaka Samhita. Let me share the screen, sir. Sir, is it visible, sir?
Yes, very clear. Thank you. Priya, we can't hear you.
Yeah, I'm just starting on it. Before going to the topic, let us see what is before starting. Let us look the importance of Samvada in Ayurveda. That is, Ayurveda means Ayusha Veda. Ayu means Jivana Kala. Ayus without Arogya is Nirubyoga. So, Dharmartha Kama Mokshanam Uttama Mulam Arogya Muchade. Hedalinga Ushadha Jnanam Sastadara Parayanam Trasutram Shashvatam Punyam Bhubadheyam Pitamaha. So, for all this Hedulinga Ushadha Jnana, it is not achieved without Vichara. Hence, the Tattva Jnana is attained only by Samvada. Before going to the topic, let us see what is Charaka. Charaka is a shakha of Yajurveda, and all the Vedas are having so many shakhas. Charaka is one among them. So the Charaka is not, I think the Charaka is not a person's name. It is a name representing that shakha. The rishis, those who adhere to this Charaka shakha, are known as Charaka. And it is explained by Charakacharya in Charaka Samhita Vimanasthana, Roga Bhishakjiti Adhyaya, that the Acharya expressed several concerns about the disease diagnosis in the chapter before. And in truth, a lack of intellectual ability is what causes the misgivings. So therefore, it is necessary to describe the ways and means, that is study and teaching, etc., so as to bring about the intellectual excellence in physicians. Hence, the chapter Roga Bhishakjiti Adhyaya is explained. First, in this chapter, it is told that first the physician should do the pariksha of Shastra and Acharya. And after that, the three methods of obtaining knowledge is explained. They are Adhyanam, Adhyavanam, and Tadvidya Samphasha. And after explaining the Adhyayana and Adhyapana in detail, Charaka Acharya has explained the Tadvidya Sambhasha in detail. And the discussion done to attain the Tattva Bodha is known as a Vada or Samvada or Tadvidya Sambhasha. These three terms are having the same meaning. And in Charaka Samhita, the Charaka included Tadvidya Sambhasha as Agriya among the Buddhivardhana Padarthas, and the Shloka told in Charaka Samhita that Buddhi Medhagara Ganasada Adhyanam Chinda Paratantra Avaloganam Tadvidya Sambhasha. All these show that the Tadvidya Sambhasha, he has given much importance for that. In Charaka Samhita, it is explained clearly that only the Tadvidya Sambhasha means the term it shows that Tadvidyehi Saha Sambhasha, that is, one should do the discussions with the persons of his own profession. So in Charaka Samhita, it is explained clearly that the Bhishak Bhishaja Sahaiva Sambhasham Kartum Arhati. And there are it is of two types, Sandhaya Sambhasha and Vigrahya Sambhasha. And Sandhaya Sambhasha means Tattva Avabodha eva mukyam prayojanam. Vigrahya Sambhasha, that is from Sandhaya Sambhasha, the main aim or prayojana is Tattva Bodha, that is attaining knowledge. And Vigrahya Sambhasha is done to defeat the opponent. Pradivadinaha Parajaya eva talparya. And the Vigrahya Sambhasha is divided into two, Jalpaha and Vidanda. The Jalpa means Ekasya Pakshaha Punarbhava Astiti Na Astiti Aparasya. Tauja Swaswapaksha Hetupihi Swaswapaksham Stapetaha Parapaksham Udbhavetaha Esha Jalpaha. That is, the Jalpa is advancement of one's own view while contradicting the opponent. And Vidanda is just the Vidanda is a type of debate. Only the opponent's view are contradicted without advancing the arguments in support of the individuals. And in Nyaya Shastra, the Maharshi Gautama explains Vada in a very detailed way. And the definition of Vada is explained in this Nyaya Shastra as Pramana Tarka Sadhana Upalambhaha Siddhanta Aviruddhaha Panja Avayava Upapannaha Paksha Pradipaksha Parigraho Vadaha. That is, Vada should be Pramana Tarka Sadhanopalambha. That is, it should be in countenance with the Pramana. It should be having the Pramana and Tarka, and the Siddhanta Aviruddhaha. That is, should not contradict the Siddhanta. Panja Avayava Upapannaha should have the Panja Avayavas in Panja Avayavas, that is Pradigna, Hetu, Drishtanta, Upanaya, and Nigamana. And this is the definition for the Vada in Nyaya Sutra. And the utility of Tadvidya Sambhasha is explained in detail but in Charaka Samhita, that is Jnana Abhiyoga Samharshakari. The Tadvidya Sambhasha is Jnana Abhiyoga Samharshakari. That is, it promotes the power of application of the knowledge. Vaisharadyamapi cha abhinirvarteti, manifests the clarity of knowledge. Vajana Shaktimapi cha adhate, that is, promotes the power of speech. Yashascha abhidipayati, spreads fame. That Purva Shrute cha Sandehavatāha Punah Shravanat Shruta Samshayam Apakarshati, that is, eliminates the doubt reminiscent of the previous study by repeated hearing of the subject. Shrude cha Asandehavato Huyo Adhyavasayam Abhinirvarteti, that is, brings about confirmation of what is undoubtedly understood before. Ashrutamapi cha Kanjidartham Shrotra Vishayam Apadedi. One comes to know many new things which were not heard by him previously. Yacha Acharyaha Shishyaya Shushrushave Prasannaha Kramena Upadishanti Guhyabhimatam Arthajadam Tat Parasparena Sahajalpan Pindena Vijigishuraha Samharshat. Being pleased over the devoted disciple, the preceptor, that is the Acharya, during the course of teaching, elaborates some secret meanings. The Tadvidya Sambhasha has a lot to do with the current education system. That is one of the best examples of Tadvidya Sambhasha in the modern era is current webinars and seminars that is which is going on. And this, in this context, the Acharya does a good job of emphasizing the interaction between the teachers and students. That is the in the present education system, the teachers and students should have a more bond, so that more things will be acquired from the teacher by the students. And in Talparya Tika, the benefits of Vada is explained as same. The similar meaning is given is there. Anathigatam Tattva Avabodha, that is understanding the unknown Tattva. Samshaya Nivritti, that is clearing the doubt. Adhyavasita Abhyanijnanam, confirmation of what is undoubtedly said before. These are called as three bhalas of Vada by in Talparya Tika. In the Anuloma Sambhasha, that is the friendly discussions is one of the type told by the Charaka Samhita. One should have friendly discussions with Jnana, Vijnana, Vachana, Pradivachana, Shakti Sampannena, with the persons of learning, process of scientific knowledge, power of argument and counter argument. With these persons only, one should have the arguments. Akopanena, that is one who do not get irritated. Anupaskrita Vidyena, that one who endowed with correct knowledge. Anasuyakena, who are not jealous. Anunayena, that is who can be made to understand. Anunaya Kovidena, who are competent in convincing others. Akleshakshamena, who are capable of facing difficult situations. Priya Sambhashanena, who can address in sweet tone. And the Anuloma Sambhasha Vidhi told by Charaka is Tatha Videna Saha Kathayan, Visrabdhaha Kathayan. That is, one should confidently discuss with such persons and put question to them. Pricheda Picha Visrabdha, that is, put questions to them. Prichade Chasmai Visrabdhaya Vishadam Artham Bruyat. When he asked anything, he should be elaborately described with, elaborately described with confidence. Naja Nigraha Bhavadu Udvijena. That is, one should not get worried under the apprehension of getting defeated. Nigrihya Jainam ki na hrishyet. One should not rejoice by defeating his opponents. Naja Pareshu Vikatheda. That is, one should not boast of having defeated such opponents. Naja Mohad Ekanda Grahisyat. One should not hold extreme views under delusion. One should not try to describe a thing which the other party does not know. One should try to bring down the other party with politeness, the opponent with politeness and not by deception. Tatra cha avahitaha syat. One should be very careful to behave politely with his opponents. And in Nyaya Shastra also, it is told that swastha sarvajana swastha. The vada should be done with these type of people. They are swastha sarvajana pratyaya anabalapi madamatra avalambi avahitaha akalahakaraha. That is swastha, that is devoid of any distraction, either mentally or physically. Sarvajana pratyaya anabalapi, that is, should consider everyone's views during the debate. They should consider everyone's views. And madamatra avalambi, that is, should concentrate only on the subject. That is, should not concentrate on the physical appearance or some other factors. Avahita should have concentration. Should be having concentration. And akalahakaraha should not do the discussion just to make the disputes. And in Nyaya Manjari it is told that Vadamja, the Vada, one should do Vada with Nirnaya Bhalarthibihi Shishyaha Sabrahmachari Gurubhihi Vitaragehi. That is, should do the Vada with the person having definite conclusion. That is Shishya, Sabrahmachari, Brahmachari, that means those who are in the stage of attaining knowledge. Gurubhihi, Guru, with the teacher, and with the Vidaragi. And should not do the Vada with should not do the Vada just for fame. And Rabhasa Pradivarthamana Sparthanubandha. that is not with the anger, just to defeat the opponent. And vidhuralmabhi should not do nishphala debate. And the Vigrahya Sambhasha told in the text is the procedure to be adopted in a hostile discussion is explained. Vigrahya Sambhasha. Yadya Shreyasa Yogyam Atmanaha Pashin. With the person other than the preceptor and the brahmacharyans, one should go in for a hostile discussion provided he is confident of his superiority. Pragevacha Jalpat Jalpandaram Paravarandaram Parishad Visheshamscha Samyak Parikshata. Before entering into the discussion, the procedure proposed to be adopted by the opponent. Difference between the abilities of himself and the opponent and disposition of the members of the assembly should be carefully examined. And a wise person, Samyak Pariksha hi Buddhimatam Karya Pravritti Nivritti Karini. A wise person determines the time of entering into the discussion and giving up the discussion only by proper examination. Hence, Tasmat Pariksham Abhiprashamsanti Kushila. Hence, the experts recommend proper examination. And there are some of the good and bad qualities explained by the Charakacharya. That is, good qualities. There are some good and bad qualities of the participant in a discussion with a view to determining the superiority or inferiority or himself in respect to his opponent. One should carefully examine these good and bad qualities. That is, Shrutam, text should be good and having the good practical experience. That is, Vijnanam, the Dharanam, power of retention, Pratibhanam, the presence of mind, Vachana Shakti, eloquence. And the bad qualities are Kopanatvam, irritation, Aiva Isharadhyam, lack of skill, Hirutvam, covered eyes, Adharanatvam, lack of proper attention, and Anavahitatvam, carelessness. And one should compare the strength or weakness of himself of his opponent in respect of these qualities. Etan Gunan, Guru Lakhavataha Parasya Chaiva Atmanascha Tulayu. And three types of opponents are explained. Pravaraha, Pratyavaraha, and Samaha. That is, depending upon the presence of the above mentioned qualities, the opponent may belong to either superior, inferior, or equal. And the assembly is divided into two, Jnanavati and Mudha Parishad. And in Nyayavartika Tika Parishuddhi, it is told that Purishavati Janata Sabhetyuchade. Purishavati, that is, those having the knowledge, the group having the knowledge should be, if the persons having the knowledge should be there in a sabha. Trividha Punaranena Karana Vibhagena. Suhrut Parishad, that is friendly. Karana Vibhagena, it is divided into three: Suhrut Parishad, Udasina Parishad, and Pradinivishta Parishad. Friendly, neutral, and prejudicial Parishad. And Vadamarga, that is next, in the text it is told about the terms of debate. That is Vadamarga, they are 44 in number, and the acquaintance with the following terms help in determination of the course of the debate among the physician. And these are the Vadamarga, Vadaha, Dravyam, Guna, etc. These are the Vadamargas. One should have the proper knowledge of these Vadamargas, then only he can do a good debate. And thank you. I thank all the organizers of this program for giving me a chance to talk on this topic. Thank you all.
Excellent, excellent, Doctor. Priyada, excellent, very nice. Nicely you have covered all the things. Ram Tirth ji.
अच्छा प्रेजेंटेशन रहा। वास्तव में जो विग्रह संभाषा है उसके बारे में ये सारा डिस्कशन था। तो महर्षि चरक का जब अपन संपादन देखते हैं तो उसमें दो तरह के प्रस्तुतिकरण और संपादन देखने को हमें मिलते हैं। एक संपादन ऐसा है जो कि पद्यमय संपादन है, पद्यमय लेखन है ग्रंथ का, संहिता का, और एक गद्यमय विषय है सारा का सारा। यदि हम चरक के प्रणयन के स्तरों को देखें कि किस प्रकार से संहिता इस रूप में जो हमें प्राप्त हो रही है, तो उसके स्तर कैसे कैसे क्या क्या थे। तो यदि हम सबसे पहले के सबसे जो आदिकाल है उसका सबसे प्रारंभिक जो समय है, वो आत्रेय और अग्निवेश का जो संवाद है, उस संवाद को अविकल रूप में महर्षि अग्निवेश ने अपने ग्रंथ अग्निवेश तंत्र के अंदर लिखा। और जब कोई शिष्य या विद्वान अपने गुरुमुख से सुने हुए उपदेश को उस नैरेटिव में लिखता है, जो कि एक लाइव कमेंट्री का या लाइव क्लास का हमें आभास होता है, तो वो निश्चित रूप से गद्यमय कथा स्वरूप में विषय रहता है। तो आचार्य चरक का जो चरक संहिता के अंतर्गत जब भी हम किसी भी विषय को देखेंगे जहां गद्यमय विषय लिखा गया है, तो वो हमें समझना चाहिए कि वास्तव में वो अग्निवेश तंत्र का मूल विषय है। यदि हम देखेंगे प्रथम अध्याय में, तो चूंकि सारा चरक संहिता जब चरक संहिताकार ने प्रतिसंस्कार किया होगा, तो आप इमेजिन कर सकते हैं कि जब अग्निवेश तंत्र आचार्य चरक को मिला होगा और वो बहुत ही भ्रंश रूप में मिला होगा, इसमें प्रथम अध्याय स्पष्ट नहीं था, दूसरा अध्याय भी स्पष्ट नहीं था, तीसरा अध्याय भी स्पष्ट नहीं था, चौथे अध्याय में जाके कहीं ऐसा एक स्वरूप दिखने को मिलता है, षड्विरेचन शताश्रिति। आज मैं जो निवेदन करना चाह रहा हूं मेरे सभी आदरणीय जितने भी हमारे वेबिनार में उपस्थित हैं, कि वो जो क्या सोच रहा होगा चरक का उस समय और किस प्रकार से उन्होंने चरक संहिता का निर्माण किया, तो उस भाव पर जाकर, उस भाव भूमि पर जाकर मैं निवेदन करना चाह रहा हूं। तो महर्षि चरक को जो अग्निवेश तंत्र मिला, उसमें जो सबसे पहला अध्याय था वो चतुर्थ अध्याय था, षड्विरेचन शताश्रिति अध्याय। और प्रारंभ के जो 3 अध्याय थे, प्रथम द्वितीय और तृतीय, दीर्घजीवितीयम अध्यायम, अपामार्ग तंडुलियम और आरघवतीयम अध्यायम, ये तीनों ही अध्याय आचार्य चरक को प्राप्त नहीं हुए थे। चौथे अध्याय में यदि आप चौथे अध्याय का एक तरह से पैटर्न देखेंगे, तो आपको लगेगा कि यार ये पैटर्न जो है वो चरक के पैटर्न से, प्रारंभ के 3 अध्यायों के पैटर्न से बिल्कुल अलग है। वहां पर वो गद्य में प्रवाह में आचार्य लिखते हैं। ऐसे जब उन्होंने कषाय कल्पनाओं को बताया, तो भी वो गद्य में है पूरा। फिर उसके बाद 50 जो कषाय हैं, 50 महाकषाय जो हैं, 500 जहां कषायों का गणना की, वो भी सारा गद्य में है। और अंत में यदि आप देखेंगे कि किस प्रकार से गुरु और शिष्य के बीच का संवाद उस अध्याय के अंत में दे रखा है, वहां पर बड़ा रोचक एक किस्सा है कि अग्निवेश जब पूछते हैं अपने गुरु से कि गुरुदेव नैतानि कषाय पंच कषाय शतानि पूरयन्ति भगवान, ऐसा कह के अग्निवेश ने पूछा कि प्रभु आपने ये जो 500 कषाय बताए हैं, यदि इनकी गणना एक एक करके ड्रग वाइज की जाए, तो इसमें बहुत सारे जो कषाय हैं वो रिपीट हुए हैं। और इस तरह से ये 500 कषाय नहीं होते हैं, ये लगभग 363 कषाय, 363 के आसपास कषाय बैठते हैं। ऐसी गणना अग्निवेश ने की और उन्होंने प्रश्न भी किया गुरु से। तो उस लाइव कमेंट्री को जो अग्निवेश लिखते हैं, तो वो लिखते हैं कि मेरे गुरु ने मेरे को डांटा और डांट के उन्होंने कहा नहीं थे देवम बुद्धिमताम दृष्टव्यम अग्निवेश, हे अग्निवेश, ये जो आपने प्रश्न किया है ये बुद्धिमान शिष्यों का प्रश्न नहीं है। तो एक तरह से वहां वो डांट रहे हैं कि ये मूर्खों की तरह बातें मत किया करो सभा में। उन्होंने कहा कि भाई जब एक कषाय से या एक औषधि से हम कई सारी बीमारियों को सही कर सकते हैं, तो क्यों ना हम उसी औषधि का चयन करें। कितने ही सारे वैद्य ऐसे हैं जो अपने नुस्खे में, अपने कॉम्बिनेशन में, अपने प्रिस्क्रिप्शन में गिलोय सत्व को रखते ही रखते हैं। मुझे ऐसा लगता है कि जो वैद्य गिलोय सत्व को अपने कॉम्बिनेशन में, अपने प्रिस्क्रिप्शन में नहीं रखता है ना, आज की वर्तमान परिस्थिति में, तो वो कहीं ना कहीं उसका जो शिक्षण है, प्रशिक्षण है, वो कहीं ना कहीं हल्का है। तो आचार्य अग्निवेश और महर्षि आत्रेय के मध्य का जो संवाद है, अब देखिए डॉक्टर प्रियदा ने संभाषा की बात की, तो संभाषा में संवाद आवश्यक है। और संभाषा बताई भी क्यों? संभाषा बताने का मूल उद्देश्य तो वाद है। और वाद भी क्यों बताया? वाद का भी मूल उद्देश्य यह है कि जो बुद्धिगम्य है, बुद्धिगम्यता है, और जो ज्ञान है वो प्राप्त होना चाहिए। इसलिए तो कहा तद्विद्य संभाषा ही ज्ञानाभियोग संघर्ष करी, कि ज्ञान की यदि प्राप्ति करनी है तो फिर बुद्धि क्लियर होनी चाहिए। और बुद्धि होती है अध्यवसाय, बुद्धि होती है निश्चय करने वाली, निश्चय कराने वाली, सही डिटर्मिनेशन को पहुंचाने वाली। तो अध्यवसायो बुद्धि कहा, अध्यवसायो बुद्धि, अध्यवसायो निश्चय, निश्चयो ही अध्यवसाय, व्यवसायो नाम निश्चय, तो व्यवसाय भी निश्चय है, अध्यवसाय भी निश्चय, बुद्धि ही निश्चयात्मिका, या बुद्धि निश्चयात्मिका। जो निश्चयात्मिका है वही बुद्धि है, और जो बुद्धिमान है वो ज्ञानवान है, उसको ज्ञान प्राप्त होगा। तो बुद्धि के लिए, ज्ञान के लिए, तत्व प्राप्ति के लिए, सत्य की प्राप्ति के लिए, परीक्षा के उपरांत प्राप्त होने वाले तथ्य के लिए संभाषा, तद्विद्य संभाषा अनिवार्य है, बेस्ट है। तो यहाँ जो चर्चा हो रही है गुरु और शिष्य के मध्य में, वो भी एक संभाषा का प्रकार है, संवाद का प्रकार है, वो प्रच्छना है वो। तो प्रच्छना में भी आचार्य ने बताया कि किस प्रकार से प्रच्छना करना, किस प्रकार से प्रश्न करना, किस प्रकार से गुरु से बातचीत करना, अपने जो जल्प जिससे कर रहे हैं, अपने प्रत्यवर है या अवर है या मध्यम श्रेणी का पर है, जो जिसके साथ आपको शास्त्रार्थ करना है, उसका भी स्तर समझना चाहिए, परीक्षा करनी चाहिए। तो आचार्य चरक वहां परीक्षा पर जोर देते हैं। रोग विषयक जिति के अंदर जहां संभाषाओं के बारे में बताया, तो परीक्षा महत्व का विषय। और 11वें अध्याय में भी परीक्षा की बात करी, तिस्रेषणी अध्याय के अंदर, ये खलु सर्वम सच्चा सत्यम, ये सारा संसार 2 भागों में विभाजित किया चरक ने, सत्य और असत्य। तस्य चतुर्विधम परीक्षा, उसकी 4 प्रकार से परीक्षा बताई, प्रत्यक्षम, अनुमानम, आप्तोपदेशम, युक्तिश्चेति। तो परीक्षा पर जोर दे रहे हैं आचार्य, उधर ज्ञान पर जोर दे रहे हैं संभाषा में। तो ज्ञान, बुद्धि, परीक्षा, ये जो 3 तत्व हैं, ये कहीं ना कहीं एक दूसरे से सामंजस्य रखते हैं, बात रखते हैं। तो आज जितना भी पैथोलॉजी का आडंबर है, इक्विपमेंट से, सबके सब परीक्षा के साधन है। MRI है, CT स्कैन है, लैब्स है, सीरम है, बायोकेमिस्ट्री है, यूरिन है, स्टूल है, सारा परीक्षा, सब परीक्षा के अंतर है। तो परीक्षा पर चरक ने बहुत जोर दिया। 19वें अध्याय में रोग माधु परीक्षित तो नंतर मोक्ष। 10वें अध्याय में कहा महारोग अध्याय, परीक्षा कारणों ही कुशला भवंती। वहां तो मैत्रेय और आत्रेय का जो संवाद है वो भी बड़ा रोचक संवाद है। हमारे गौड़ साहब, परम पूज्य गौड़ साहब गुरुदेव उस संवाद को बड़ा रोचक तरीके से बताते। मैत्रेय ने विरोध किया चिकित्सा का। देखिए आप, ये मैं चरक और अग्निवेश का जो स्टाइल है उसके डिफरेंस के मैं भी साथ में बात करता रहूंगा आपसे। तो 4थे अध्याय के अंदर जो प्रस्तुतिकरण है अग्निवेश तंत्र का, वो गद्यात्मक है। फिर वो 5वें अध्याय के अंदर भी प्रारंभ में गद्यात्मक रहा, मात्रा श्रुति के अंदर, मात्रा ही अग्निबलापेक्षणी, ऐसे कह के वहां पर गुरु और लघु का विचार किया गया। आगे फिर जब दिनचर्या के श्लोक शुरू हुए, धूमपान के श्लोक शुरू हुए, नस्य के श्लोक शुरू हुए, अणुतेल की विधि का वर्णन हुआ, व्यायाम के बारे में बताया थोड़ा बहुत, इधर स्नान के बारे में बताया, अभ्यंग के बारे में बताया, फिर दंड धारण के बारे में बताया, भयग्नम दंड धारणम। तो ये जो बाद के श्लोक हैं वो चरक के द्वारा प्रणीत किए गए। परंतु प्रारंभ का जो बड़ा गंभीर विषय है, जो आहार मात्रा, नित्योपयोगी आहार, गुरु आहार, लघु आहार, कुक्षी के ऊपर प्रभाव पड़ने वाला आहार का, और महाभूतों के साथ आहार का जो तादात्म्य है, वो सारा विषय बड़ा गंभीर विषय है, जिसको कि अग्निवेश और आत्रेय के समय का वो विषय है वास्तव में। आप पैटर्न को पकड़ने की कोशिश कीजिए कि पैटर्न क्या है चरक का और अग्निवेश का, तो उससे हमें उसके काल का भी निर्धारण हो जाता है। आप देखेंगे छंदों का जो वर्णन है, अनुष्टुप छंद है, उपजाति छंद है, शैखरिक छंद है, द्विजाति छंद है, मालिनी छंद है, जितने भी छंद हैं, तो उनमें से जो अनुष्टुप है वो भी दो भागों में विभाजित है। एक वैदिक कालीन अनुष्टुप छंद है और एक उत्तर वैदिक कालीन अनुष्टुप छंद है। तो पाणिनि के आविर्भाव के बाद जो उत्तर वैदिक कालीन अनुष्टुप छंद है, जो चरक संहिता जिसमें सामान्यतः लिखी गई, हिताहितम सुखम दुखम आयुस्तस्य हिताहितम मानम च तच्च यत्रोक्तम आयुर्वेदस्य उच्यते, इस स्टाइल में जो पूरी चरक संहिता लिखी गई है, ये अनुष्टुप छंद उत्तरकालीन है और ये भी पाणिनि के बाद का डेवलपमेंट है। पाणिनि का समय 8वीं शताब्दी ईसा पूर्व और चरक का समय 2री शताब्दी ईसा पूर्व है। तो ये जो 400 साल का डेवलपमेंट है व्याकरण का, इसका फायदा चरक को मिला और चरक ने अपने ग्रंथ को एक श्लोक में, कविता के रूप में, पद्य के रूप में डेवलप किया। क्योंकि ये बड़ा एक मुश्किल काम है कि किसी भी बड़े ग्रंथ को और गद्य के कलेवर में लिखना, और वो भी संस्कृत जैसी प्रांजल भाषा में। तो कमेंट्री तो आप लिख सकते हैं गुरु और शिष्य के बीच की, पर वास्तव में यदि किसी को कंक्लूसिव रूप में यदि हमें कोई चीज लिखनी है, तो फिर आप देखेंगे चरक के अंदर भवंती छात्र, भवंती छात्र, भवंती छात्र, ऐसे कह के चरक बहुत जगह उसको कंक्लूड कर रहे हैं। तो किसको कंक्लूड कर रहे हैं? वो आत्रेय और अग्निवेश का जो संवाद है उसको कंक्लूड करते हैं श्लोकों में। षष्टिकांशालि मुद्गांश सैंधवामल के यवान। तो ये कंक्लूजन है कि भाई आहार मात्रा है, नित्योपयोगी आहार के बारे में डिस्कशन करते हैं। फिर नित्योपयोगी आहार के बारे में सच्च नित्यम प्रयुंज्यते स्वास्थ्यम येन अनुवर्तते। तो इस चरक का जो स्टाइल है उसको आप समझें तो आपको संहिता के निर्माण के स्तरों के बारे में ही पता चलेगा। और फिर वही बात आ जाती है संभाषा और संवाद की बात। तो संवाद है, वहां पर गुरु और शिष्य का संवाद है। तो जो 10वां अध्याय है, और जो 10वां अध्याय है मैत्रेय और आत्रेय के बीच का जो संवाद है, वो वास्तव में विग्रहीय संभाषा का संवाद। तो आपको एक ही संहिता के अंदर संधाय संभाषा भी मिल रही है और विग्रहीय भी मिल रही है। आप 12वें अध्याय में जब जाएंगे वाद कला कली में, तो आपको संधाय संभाषा मिलेगी। उससे पहले 2 अध्याय पहले 10वें अध्याय में ही आपको विग्रहीय संभाषा है। अब मैत्रेय कहते हैं चिकित्सा और अचिकित्सा में कोई अंतर नहीं है, साधारण है, अविशेषेणम इति। तो विरोध किया उन्होंने कि आवश्यकता ही नहीं है। फिर वो कहते हैं मैत्रेय कि जिसकी चिकित्सा करते हैं वो भी मर जाता है कभी कभी, और नहीं करते हैं तो भी मर जाता है आदमी। तो जब मरना ही है तो चिकित्सा क्यों करनी? ऐसा कुतर्क जो है वो मैत्रेय के द्वारा रखा जाता है। अब मैत्रेय ऐसी बातें क्यों करते हैं, नकारात्मक बातें क्यों करते हैं मैत्रेय? इसके जब अपन उसमें जाते हैं, गहराई में जाते हैं, तो आपको जानकर एक बड़ा आश्चर्य होगा। मैत्रेय कौन है? मैत्रेय एक महाभारत कालीन ऋषि हैं। और जब अपन वन पर्व में महाभारत में जाते हैं, वन पर्व में, तो पांडव जो हैं वो मैत्रेय के साथ रहते हैं बहुत। और पांडव जब मैत्रेय के साथ रहते हैं तो जो द्रौपदी है वो बहुत परेशान है, कुंठित है, गुस्से में है, क्रोध में है व्यवस्थाओं को लेके, और विशेष रूप से अपने पति धर्मराज के ऊपर, युधिष्ठिर के ऊपर। और इधर से सारे जो पांडव हैं युधिष्ठिर के साथ, वो सभी के सब निराश हैं, कुंठित हैं, दुखी हैं, अपने वनवास के कारण से, अपने साथ हुए छल के कारण से, अपनी हार की वजह से, और कहीं ना कहीं जो धर्मराज ने द्रौपदी को दांव पर लगाया उस गुस्से की वजह से, और उनका अपमान हुआ उसकी वजह से। तो मैत्रेय पर जो प्रभाव है वो कहीं ना कहीं निराशा का, नकारात्मकता का एक प्रभाव है। वो प्रभाव पांडवों का भी प्रभाव है उनको ऊपर। ऐसा यदि हम एक बार स्टडी करें, साइकोलॉजिकल स्टडी है ये, कि व्यक्ति जैसे वातावरण में रहता है वैसा ही उसके ऊपर प्रभाव आता है। यद्यपि मैत्रेय जो है पांडवों को समझा भी रहे हैं। एक जगह मैंने ये भी पढ़ा है, एक जगह कि जो द्यूत क्रीड़ा आचार्य, द्यूत क्रीड़ा जो खेलते हैं युधिष्ठिर, उसके भी जो निष्णात हैं वो आचार्य मैत्रेय हैं कि द्यूत कैसे खेला जाता है। तो वन पर्व के अंदर मैत्रेय ने युधिष्ठिर को द्यूत की भी कुछ विशेष कलाएं सिखाई, कैसे द्यूत खेला जाता है। ये चलो प्रकारांतर की बात आ गई, मेरे को थोड़ा स्मरण आ गया, इसलिए मैंने आपके सामने निवेदन किया इस विषय को। तो वहां पर आचार्य महर्षि आत्रेय जो है वो तो साफ साफ कहते हैं कि जो मैत्रेय की तरह जो मिथ्या बुद्धि है, तो कहते हैं आखिरी में कि मिथ्या बुद्धि प्रकल्पयेत न मिथ्या बुद्धि प्रकल्पयेत। हे अग्निवेश, तुम मिथ्या बुद्धि में बिल्कुल भी ध्यान मत दीजिए। और 11वें अध्याय में जब तिसरेषणी अध्याय आता है तो वो इतने ज्यादा गुस्से में रहते हैं आत्रेय, भगवान महर्षि आत्रेय, तो वो कहते हैं कि पातकेभ्यः परम पातक, पातकेभ्यः परम पातक नास्तिको ग्रह। ये सबसे बड़ा पातक क्या है, सबसे बड़ा पाप क्या है संसार में? सबसे बड़ा पाप है नास्तिक का ग्रहण करना, नास्तिक के साथ बैठना, नास्तिक के साथ डिस्कशन करना, नास्तिक को स्वीकार करना, जीवन के अंदर, जिंदगी के अंदर अपनी नास्तिकता को अपने ऊपर ले लेना, नकारात्मकता को स्वीकार कर लेना, ये सबसे बड़ा पाप है। क्यों? क्योंकि वो मैत्रेय की नकारात्मकता को दरकिनार करके आए, उसको डिस्कार्ड करके आए, बॉयकॉट करके आए, उसको बोल के आए कि तुम मूर्ख बुद्धि हो, तुम मिथ्या बुद्धि रखते हो, तुम्हारी बुद्धि अच्छी नहीं है, तुम अपने माइंड सेटअप को ठीक करिए। और फिर इसलिए 11वें अध्याय में आगे वो बार बार कहते हैं। और फिर आगे 25वें अध्याय में यहाँ यज्ञ पुरुषी अध्याय का डिस्कशन हुआ, संध्याय संभाषा हुई, वहां भी पुरुष की उत्पत्ति को लेके, रोगों की उत्पत्ति को लेके ऋषि मुनियों में खूब डिस्कशन हो रहा है, एक दूसरे की बातों को काट रहे हैं, अपना पक्ष रख रहे हैं, खंडन मंडन कर रहे हैं। पर अंत में महर्षि आत्रेय यही कहते हैं कि अपन आपस में एक दूसरे को तिल और गुड़ की तरह कूटे नहीं, एक दूसरे को दबाए नहीं, हमको कंक्लूजन निकालना है कुछ ना कुछ। तो फिर आचार्य महर्षि आत्रेय ने वहां पर कंक्लूजन निकाला, येषामेव भावानां संपत् संजनयेन्नरम् तेषामेव विपद व्याधिन विधान समुदीरे। जिन भावों की संपत्ति से शरीर का निर्माण होता है, उन्हीं भावों की विपद से रोगों का भी आविर्भाव हो जाता है। वह कंक्लूजन देते हैं, लेकिन आगे फिर बोलते हैं नास्तिको वर्जनम, नास्तिक को तो वर्जित करना ही चाहिए। तो ये महर्षि आत्रेय और अग्निवेश का जो संवाद है वो ज्ञान की वृद्धि कराने वाला है, बुद्धि तत्व को देने वाला है, अध्यवसाय को देने वाला, निश्चय को देने वाला, व्यवसाय को देने वाला, वो परीक्षा के सत्य को बताने वाला है। तो फिर वाद मार्ग भी बताया उन्होंने, 44 वाद मार्ग बताए। क्यों बताए? परीक्षा के लिए बताए, बुद्धि के लिए बताए, ज्ञान के लिए बताए। यदि आपको ज्ञान प्राप्त करना है, तत्व प्राप्त करना है, तो ये वाद मार्गों का सहारा लीजिए। वाद मार्ग क्या है? वाद डिस्कशन करना, ये वाद है। आज आप रॉ को देखिए, रिसर्च एंड एनालिसिस विंग, रॉ भारत की सबसे बड़ी गुप्तचर संस्था है। आज वो भी कोई रिसर्च करती है, रॉ, वो किसके आधार पर करती है? तथ्यों के आधार पर करती है, अपने जासूसों के माध्यम से करती है। और जासूस कैसे पता लगाते हैं? संवाद के द्वारा, मुखबिरी के द्वारा, जानकारी जुटा के, डिस्कशन करके। तो संवाद जो है वो हर तथ्य को प्राप्त करने के लिए जरूरी है। सीआईडी देख लीजिए, सीबीआई देख लीजिए, सेंट्रल ब्यूरो ऑफ इन्वेस्टिगेशन, परीक्षा का केंद्रीय संस्थान है वो भी किस पर आधारित है? डिस्कशन पर आधारित है। ईडी के नाम से तो सब परिचित होंगे। हम तो हम तो गरीब लोग हैं, तनख्वाहजीवी लोग हैं, पर जो जिनके पास अच्छा खासा पैसा है वो ईडी के नाम से आतंकित। ईडी भी क्या करता है? संधाय संभाषा करता है, प्रेम से, आराम से, तसल्ली से, बता भाई ये कहां से आया 340 करोड़ रुपए, आज जालना में निकला।
प्रियदा केवी झोपायला लागली त्याचा ऐकणं पहिली जी बोलली प्रियदा,
तो संभाषा जो है वो तत्व के ज्ञान के लिए आवश्यक है, ज्ञान के लिए आवश्यक है, शास्त्र का ज्ञान उपाय है वो। अब हमें वैद्य को क्या ज्ञान प्राप्त करना? वैद्य को तो रोगी का रोग का निदान करना।
वीडियो चालू है ना,
तो इस प्रकार से संभाषा हमारे जीवन में बड़ा आवश्यक है, और संधाय संभाषा ही आवश्यक है, विग्रह नहीं करना। परिवार के अंदर भी इसको अप्लाइड एस्पेक्ट पे उतारना। चरक का जो संधाय संभाषा और विग्रह संभाषा का प्रकरण है, यदि आपका पार्टनर जिसको कि पर जल्प करना है या वितंडा करना है उसके साथ, तो परिवार में उसकी परीक्षा करना है कि भाई ये मध्यम श्रेणी का पार्टनर है हमारा, या अवर श्रेणी का है, या उत्तम श्रेणी का पार्टनर है, पर कैसा है? तो परेण सह जल्पम कुरुते, पर किस जो सामने वाला अपना प्रतिस्पर्धी है, पार्टनर है, जिससे डिस्कशन कर रहे हैं, वो कैसा है? तो परिवार के अंदर संधाय संभाषा ही करना, तभी कोई कंक्लूजन निकलेगा। और अपन तो विग्रह करने की स्थिति में रहते भी नहीं है सामान्यतः, और करना भी नहीं चाहिए। तो चरक का जो कुल मिला के एक तरह से पैटर्न है, उसको हम समझें, और जहां जहां ये संभाषाएं आई हैं, जहां जहां डिस्कशन हुए हैं, वो वास्तव में अग्निवेश तंत्र के कंटेंट्स हैं। और जहां जहां कंक्लूसिव श्लोक में रूप में यदि कोई विषय वस्तु आई है, तो वो चरक का विषय है, चरक का संपादन है, ऐसा मेरा निवेदन है। मैं क्षुद्रमती हूँ, बहुत छोटा हूँ उम्र में, आप सब लोगों का बहुत ही अनुज हूँ, आप लोगों का बड़ा बड़प्पन है, तो मेरे जैसे व्यक्ति को भी इतना महत्व दे देता नहीं है। पवन भाई साहब का बड़ा मेरे ऊपर अगाध स्नेह है, सर को बहुत बहुत आभार, शुभकामनाएं, और आपका स्वास्थ्य बहुत अच्छा रहे। मैं मोबाइल पर बहुत ज्यादा फैमिलियर नहीं रहता वेबिनार में, इसलिए मैं बचने की बहुत कोशिश करता हूँ, कैसे भी भाई साहब के प्यार से बच जाऊं। तो भाई साहब का जो प्यार का समंदर है, इसमें बस डूब ही जाते हैं इसलिए आना पड़ता है।
थैंक यू रामतीर्थ जी, थैंक यू। ये तुम्हारा है, मेरा नहीं है।
चलिए भाई साहब, बहुत बहुत धन्यवाद। एक जरूरी फोन आ रहा है, मैं 5 मिनट में आ रहा हूँ, वापस आ रहा हूँ, आप थोड़ा सा और कंटिन्यू करिए कार्यक्रम।
So now I would like to request Dr. Anuradha.
Humble pronouns to the dignitaries. I'm here to present the concept and application of Vamana Karma. Myself, Dr.
Yes.
Anuradha, working as a Panchakarma consultant in private consultancy in Trichy, Tamil Nadu. I'm now here to discuss the concept and application of Vamana Karma based on Charaka Samhita, the principles, and along with that, the application in the present era. Shall I start, sir?
Yes, madam, please proceed. Please proceed.
Okay. So we'll start with basic concepts and the application of Vamana. Coming to the Panchakarma, Vamana is the first Shodhana mentioned. And Vamana can be considered as an absolute Shodhana because Vamana and Virechana can be considered as absolute Shodhana because in other karmas like Basti, Nasya, etc., we have actions other than Shodhana like Brahmana, Shamana, etc. Whereas in Vamana and Virechana, you can never find some Brahmana Shodhana type. So it can be considered as absolute Shodhana. And the term Vamana is derived from Vam Dhatu with Lut Pratyaya. And Vam means Udgirane, that which forcefully expels out something. And Dosha Harana Urtva Bhaga Vamana Saknyakam is the commentary told on Charaka Siddhi Kalpana Siddhi chapter 1. So we are explaining the dosha from Amashya through the Urdhva Bhaga by the process of Vamana. And we also have another definition by Sharangara telling that the expulsion of Apakwa, Pitta and Kapha from the Amashya is done by the process of Vamana. And what should be the basic criteria for a patient to conduct Vamana is told in Charaka Sutra Apamarga Tandulya Adhyaya. Here is the first reference where we get the term Panchakarma in Charak Samhita. So, Tani Upastita Doshanam Sneha Svedopapadanaihi Panchakarmani Kurvita Matra Kalau Vicharayan. So, the doshas must be in a state of Upastita. That Upastita state could be brought with the help of Purva Karma, Rukshana, Sneha Sveda. So, what is Upastita is clearly explained by Chakrapani as Acharya Chakrapani, as it is a stage where the doshas get detached from the Shaka. Shakhan Muttva, they reach the Amashya or Koshta, and therein they are in a state Pradhana Avastha. That is, they are not in any more state of Leena Avastha. They are loosened from the Srotas and which are in a state of expelling out. So, and this stage is brought with the help of Purva Karma. And we all know Vamana has to be adopted as Ritu Shodhana. It is mainly recommended in Vasanta Ritu because of the Chaya Avastha of Kapha in Shita Ritus of Hemanta and Shishira. And then coming to Vasanta because of the Ushnata by Aditya, there will be liquefaction of the Kapha which was in Chaya Avastha previously. And due to the Drava Guna Amsha increase in the Kapha, there will be reduction in Swabhavika, there will be reduction in the Agni. So because of Agni Mandya, there are probably chance of Kapha Vikaras are more. Hence, both the Kala and Dosha here is suitable for Vamana. Hence, Vamana is highly recommended in Vasanta Ritu as a regular Ritu Shodhana in Swastha people. Now, coming to specific conditions which are mentioned, Kapha in its own sthana, Pitta mixed Kapha, Pitta in Kaphasthana, and Pitta Vata in Kaphasthana. Just few examples I have taken from the Chikitsa Sthana, that Kapha in own sthana, we can find the Samprapti in Tamakashwasa, Pitta mixed Kapha in Amla Pitta, and Pitta in Kaphasthana in Unmada and Jora, Pitta Vata in Kaphasthana in Madatiya. Apart from these, in all Kaphaja Nanatmacha Vikaras, Vamana is highly recommended. So in common practice, we adopt Vamana in PCOD, chronic sinusitis, gastroesophageal reflux disease, and in deep skin disease, especially in psoriasis, chronic rhinitis, diabetes mellitus type 2, and few psychiatric disorders like depression, schizophrenia, obesity, and COPD and thyroid disorders. So there is also a concept named Sadhya Vamana in our classics, and herein where and why should we adopt Sadhya Vamana is clearly mentioned. The doshas are already in a state of Utklesha, that is, it has reached Bahudosha Avastha. You need not induce it by Purva Karma like Sneha Sveda, and you have also no time to do Purva Karma because you are in a state where you need to do for emergency Shodhana, and doshas have already reached Amashya. And specific indications are in Navajora, Shwasa, Ajirna, and Visha. In all these four stages, we have no time. So, Shodhana is adopted here. And in Charaka Siddhisthana, Trivida Kukshi Adhyaya, he explains Alasaka and Vishuchika, wherein the treatment, he comments that Tatra Sadhya Mamam Pradushtam Alasi Bhutam Ullekhayet Adau Payitwa Salavanam Ushnavari. So Ullekhana refers to Vamana here. Vamana is the first line of treatment adopted in case of Ama, that is Alasi Bhuda, Pradushta Ama, not simple Ama, it's Prabhuda Avastha. And for Sadhya Vamana, he recommends Salavanam Ushnavari. That is simple Saindava Jala is taken. And herein I would like to share a simple experience which I had in my postgraduate night duty actually. A patient, he was actually in bit anxiety and he drank some phenyl actually. And he got, and some bystander was nearby and they called immediately the duty nurse and I got a call. Actually, I was frustrated. I thought I should refer, but he was not in a condition to be referred immediately and we didn't get ambulance also. So when I called my teacher, she said, just don't worry, go with Saindava Jala Vamana immediately, give him, and then followed by a gargle with Murivanna, which is very common in South India, especially Kerala, and is used and highly known efficacy for its healing nature actually. So we did Sadhya Vamana, in fact, in the night, followed by this Murivanna gargling, and then we referred him to the hospital. But actually, he was safe. But what I felt was that was the right decision taken by my teacher, and that time because the dravya which he drank, he did not go into paka avastha or never get absorbed through the intestine. So before that, in the state of amasya itself, we could expel it out. So this was the experience I had with Sadhya Vamana. And then let's see if you logic behind the principles of Vamana here. So the need of Purva Karma, we already know that because to bring the state of Upasthita, we use Purva Karma Sneha Sveda, which is already mentioned. And there are five factors mainly involved in this during the stage of Purva Karma. One is Vriddhi, Dosha Vriddhi, Dosha Vishyandanam, Dosha Paka, and Sroda Mukha Vishodhana. Finally, Vayu Nigraha. That is, with the help of Snehana intake, there will be Dosha Vriddhi, obviously some sort of Kapha Utklesha. Vishyandana is Vilena Rupi Vriddhi of doshas, and Dosha Paka is obtained because of the Ushna Guna of Svedana. And then Sroda Mukha Vishodhana occurs because the Leenatva stage is dissolved, and then it is in a state where the doshas get liquefied so that it never stucks anymore into the Srotas. That is why Srota Mukha gets Vishodhana. And finally, Vayu Nigrahana occurs, maybe by the Shamana action of Sneha we use here. These are the five categories. And then next is we give a gap of 1 day before Vamana after Samyik Snigdha Lakshana. So that Vishrama Kala is important. This is mainly to give rest to our body because of the tiresome effect of Sneha Pana which he had undergone. And to maintain the Utklesha stage of Kapha, also to prepare him for next further purification. So this Utkleshana is maintained by his Ahara. That is, we give on day prior to Vamana, we administer Masha preparation, generally like Masha, Payasa, Idli, etc. And like curd rice, steamed fish, Shira Peya. And we should advise him to go for proper sleep at night. Else there can be chance of little Vata Kopa. And then Vega Udirna also. Here also, we should not administer all these Masha Dravyas which are fried, because there are chances of Vidahi when you administer like Vada, all those things. So here again, all steamed and boiled foods with the Kapha Utklesha Dravyas are generally at least. So during the procedure, first we'll start with the Avagupanas. Snigdha Avagu is advised basically. So when you consume a semi-solid food, the pyloric antrum obviously closes, but with the liquid food, the pyloric antrum never closes. So to close the pyloric antrum so that the further stages will not cross amasya, that is, there will not be aushadha paka. So when you make the doshas and the dravyas to retain in the amasya. So this is the first step where we advise Avagupana, and then followed with Akantapana. Akantapana helps in distension of the abdomen. So we have a mechanical distension which peripherally induces the Vamana. And next coming to Vamana Aushadha. Vamana Aushadha will be very specific to the dishes. Multiple Aushadas are told and multiple preparations also. But generally we use Madana and Kudaja. Madana is very commonly used. And generally all Vamana Aushadas have Ushna, Tikshna, Vyavayi, Vikashi Guna. By these actions, they stimulate the central emetic system and the medullary region, so that chemoreceptor trigger zones are also stimulated. Next, coming to the next step, that is we advise the patient to have Kashaya. So we have started the initial bounce of Vamana with Akandapana and the Vamana Aushadha. So things up to pyloric antrum will be expelled out with the initial intake, and then we induce further Vamana. So there will be some negative osmotic pressure created towards the lumen of GAT. And we generally administer ST Kashaya behind that. So it again creates a positive osmotic gradient towards the lumen. So both these pressure together helps in forceful extraction of the substances which are easily detachable from the lumen. Hence, the excessive lipid consumed during the Snehapana will also be expelled along with this. So, when to stop Vamana, it is clearly told as Pittanta is the Shuddhi Lakshana. And not Shuddhi Lakshana, it's a stage where you have to end Vamana. Okay, so repeated emesis we again causes generation of negative pressure up to second part of duodenum. Even after giving ST Kashaya, when you start again with Saindava Jala, so there can be chance of creating again a negative pressure towards the duodenum. So by where the bile duct and pancreatic duct open into ampulla of water. So this negative pressure gradient cause forceful expulsion of bile from the gallbladder. So that can be correlated as Pittanta in the Vamana Karma. Next, coming to Samsarjana Krama, we all know Peya, Vilepi, Akrita Krita Yusha and Akrita Krita Mamsa Rasa are consecutively administered after Vamana Karma. So the logic behind it is we need carbohydrates and fats for the energy storage. And after Shodhana, they cannot be hugely administered because they require much enzymes to digest, so which can again hamper the Agni. So to start with, we are starting with basic cereals, Shukadanya, which are given in the form of Peya again. So Peya is much of liquid, so that we require less hydrochloric acid compared for it to digest compared to the solid food consumed. Then come to next step, which is Bilepi, which is semi-solid and it requires more digestive enzymes. And coming to Yusha, wherein we introduce protein slowly, that is pulses or Shimbidanya, without fat and spice, followed by fat and spice. So these fat added also stimulates bile secretion because bile is needed for the digestion of fat. Hence, slowly the enzymes are developed to digest carbohydrates and fats are secreted in the GIT. And the deficiency of lysine in cereals actually is compensated by rich amount of lysine in the pulses, whereas rich amount of methionine in cereal compensates the lack of methionine in pulses. Next, so that the amino acid again comes where micronutrients also we are introducing slowly through this. Finally, coming to Mamsa Rasa, which is protein rich, which needs more enzymes and hydrochloric acid to denature. Hence, all the three major components are gradually increased in the body so that no Agni Vaishamyas occurs in his body. And coming to the utility of Vamana in current scenario. So these are the common diseases where we adopt Vamana: in psoriasis, depression, and then thyroid disorders, asthma, Amlapitta, and PCOD or lifestyle disease including obesity. So coming to Vamana in Shwasa, the common respiratory diseases where Vamana is advised nowadays are asthma, COPD, bronchiectasis. And we know histamines are released due to antigen interaction with IgE antibody. Its action on bronchial smooth muscle accounts for the allergic response. And in picture, you can visualize the normal airway, asthmatic airway difference. Because of the histamine, there will be increase in inflammation and there will be tightening of the smooth muscles. We know Uras is Kapha sthana and Shwasa is the Kapha vitiated in its own sthana, where Vamana is the best adopted choice. And Vamana removes toxins from the respiratory tract and is understood that the histamines are washed out from the tract. So it stabilizes histamine production mechanism also. we have all undergone a big pandemic situation now with COVID-19. So basically, in the benefits of Vamana, we can find in Sushruta like Kasa Upalepa, Swarabeda Nidra, Tandrasya, Kapha Upasarga is mentioned. That is, pandemic is obviously an Upasargiga Vyadi, and mainly the immunity of respiratory tract was affected with COVID-19 attack. So if we had undergone at least a proper Ritu Shodhana, we could have at least encountered the intensity of the virus at least. And next common thing where we adopt Vamana is Kushta. So generally in deep skin diseases, there will be molecular level inflammation due to the formation of soluble antigen and antibody complex. So in this context, usually repeated Shodhana is advised, that is Paksha Vamana is advised. Commentator Chakrapani says, Stoka Nirharana should be done. That is very alpa amount of dosha should be done in a single Vamana. You cannot simultaneously drain out the huge amount of doshas. If Prabhuda Shodhana is done, the bala of the patient again gets much deteriorated and chance of Vata Kopa is more again. Hence, repeated Vamana, Stoka Nirharana, may help to clear the antigen antibody complex, thereby reduction in the molecular level inflammation also. And coming to Vamana and Sthaulya, we know obesity is mainly due to the imbalance of energy intake and expenditure. And it's clearly mentioned under Bahudosha Lakshana, which is directly indicated for Shodhana. And involved dosha is Kapha and Meda Avrata Vayu in the Samprapti. So in the selection of drugs also for obesity, basically Thailapana is advised compared to other snehas, because Thaila is Marutaknam, Nachas Leshma Vardhanam. It mitigates Vata, but it never increases Kapha also. So Thaila is the best opted choice of Snehapana here. And in Manovikaras, generally we come across many stressful situations nowadays. So it is better to undergo Vamana once in at least a year as a Ritu Shodhana, because we have multiple sthanas of manas in our body, and finally we can conclude Manovaha Shotas is there throughout the body. And because manas and Sharira are interrelated, once mind is affected, Sharira also gets affected simultaneously. So any kind of manovikaras like anxiety, depression, schizophrenic, etc., which is associated with Tandra, Gaurava, Alasya, or Ati Nidrada, etc., which are basically the Kapha Vardhaka Lakshanas, it is better to adopt Vamana there. Also, in the benefits of Shodhana Karma, we can see Buddhi Prasadam Balam Indriyana, which is told. That is, the person after Shodhana would definitely get his mind refreshed and regains his memory also. So, it's better to adopt Vamana at least in a year. And Vamana in PCOD, PCOD is basically a hormonal imbalance affecting the follicular growth during the ovarian cycle, causing the affected follicle to remain immature. And it's very common nowadays. It's a drastically emerging disease nowadays in reproductive aging women. So let's consider this as Agni Vaishamya Janya Vyadi, maybe due to the vitiated metabolism, wherein Rasa Dhatwagni and Medo Dhatwagni is hampered due to Kapha Vata dosha. So when you adopt Virechana directly, there can be a chance of Pittakshaya, hence there are Arthavakshaya. So even if the condition demands Virechana, it is better to go after at least as a form of Sadhya Vamana, then go for Virechana. So basically the Kapha Nirharana has to be there. So the Srota Rodha of Kapha has to be cleared, so that then next procedure can be done as Virechana also. Coming to again the thyroid disorder, the deficiency of thyroid hormone resulting in generalized slowing down of our metabolic process. That is what meant in hypothyroidism, which is very commonly seen again nowadays. And here we can understand Kapha dosha plays a major role, because there will be diminished basal metabolic rate, so that again the action of Agni is hampered, so that the metabolic rate is also diminished. So we also know the silent features of hypothyroidism are weight gain, puffy face, breathlessness, etc. So they again represent Bahudosha Lakshana, which is directly an indication of Shodhana. Finally, coming to Vamana in Amla Pitta, commonly seen Amla Pitta conditions which can be correlated are gastritis, gastroesophageal reflux disease, peptic ulcer. So here also the first line of treatment, Urdhvaga Amla Pitta, is recommended as Vamana. Amla Pitta is Kafanubandha Pitta Pradhana Vyadhi. So when we come through the Samyak Lakshana of Vamana, Kramat Kapha Pittam Atha Anilascha Iti. Is the so that along with kapha there will be expulsion of pitta and to some extent vayu also. And again coming to the antika shuddhi, pittanta is told in Vamana, so which denotes some amount of pitta is also expelled during this karma. So adopting shamana therapy with Tigda Dravyas after this Shodhana therapy may give better result in this condition rather directly going for shamana therapy. So coming to the conclusion, so Vamana Karma thus basically helps in promotion of health, prevention of disease in Swastha, prevent the recurrence of the disease, and it's the ultimate treatment for all Kapha Pradhana Vikaras. Even Vamanadi Shodhana Karmas before Rashayana therapy enhances its efficacy. The phala of Shodhana given in Charaka Samhita Sutrasthana is Evam Vishuddha Koshtasya, that is after Shodhana, Kayagni Rabhivartade, Vyadhyascha Upashamyanti, Prakritischa Anuvartade, Indriyani Mano Buddhi Varnascha Asya Prasidadi, Balam Pushti Apatyam Cha Vrshatacha Asya Jayate, Jaram Krichirena Labate, Chiram Jivati Anamayaha, Tasmat Samshodhanam Kale Yukti Yuktam Pibet Nara is told. Thank you. And I thank you all for giving me such opportunity. Thanks to the organizers.
Thank you, Dr. Anuradha. Thank you very much. You have covered your topic well.
Thank you, sir.
Dr. Madam sir.
Pavanji Pranamji, thank you so much. I want to first of all thank both our speakers for their amazing, in-detailed presentation. And it is incredible and satisfying to see that we have this kind of scholarship in the country today. So I feel very relieved that we have this level of scholarship here with us. And a big thank you to both the speakers. More importantly, our special thanks to the Sharmaji, who is not here with us. He left us in between. I hope he will join us because his poetic rendition of what is, he takes us, Ramtirthji challenges us to think at the time when Agnivesh and Charaka are discussing. He says, look at this section, look at this section. And that is such a story-like way of taking us deep into how we should really start to enjoy these discussions. Now, the question of Sambhashan, Samvad, Tadvidya Sambhashan, that Priya offered, and the detail. Now, for me, what is amazing, Priya, is that this quality of rules and regulations and cordiality that is expected in Sambhashan is described in a Samhita that is thousands of years old and with such clarity. So you could bring that out so clearly. And I want to thank you. There are many questions coming here, which are about where our two scholars today, where did they study? Maybe we will hear it from the scholars themselves. And also for younger people, there is a question coming up here saying, why have you committed to Ayurveda? Why have you spent so much time and you're continuing to read the texts and learn from the texts? And you know every detail. So our young scholars are asking these questions. We will hear these questions directly from, answers to these directly from our speakers. Finally, a few more comments here. I'm very happy to welcome Professor Dr. Shrikant Babu Perugu, who is the medical superintendent at the Ayurveda College in Hyderabad. Shrikant Babu, Shrikant Garu, namaskar. Thank you for joining us today. I can see that you have taken time to stay with us. I know as medical superintendent of a busy hospital, you have many responsibilities there in Hyderabad, but thank you so much for staying here with us and listening to our two scholars. We would like to hear from you also, because earlier today, you were talking about discussing Indriyasthana of Charaka Samhita. Now, so Priya, thank you very much for taking us into the depths of how to manage Sambhashan and what are the rules and regulations. And a special thanks to our presenter from Trichy, Anuradha. Thank you so much, because in Anuradha's presentation, I'm so happy to see how that ancient knowledge from thousands of years is being connected with the terminology of contemporary anatomy and physiology. And this is something that we need to see happen much more. Anuradha, you have taken us into the depths of all those descriptions that are familiar to the modern physiologist. And we need that language today, because there are some discussions going on about with the WHO, World Health Organization, in the context of the Global Center for Traditional Medicine that's coming up in Jamnagar. There are some discussions going on about Panchakarma. And Panchakarma, in terms of standardizing the procedures, in terms of making it accessible for the whole world. You talked about why and where you have to do certain interventions across the seasons. You touched on very nicely about the significance of some Ritu Vamanas for offering resistance to certain diseases, whether they are seasonal diseases or whether they are infectious diseases. It is very clear they offer some kind of resistance. Now, what Ayurveda has not done to date is to make this bridge. Somehow it has been difficult, because it has always stayed in one side, saying we cannot translate these terms. But what Anuradha has shown us today is the ease with which we can do this translation and interconnection. So thank you, Anuradha. We have several people here. I can see Naveenji joining from Delhi. Naveenji, Pranamji, thank you for joining us today. And I can see Rajanji Patankarji, who's always been teaching me about Sadyavamana. And Rajanji has raised his hand. So with those few words, I give the floor to our guests, guests today, with first question, comment from Rajanji. Rajanji, namaskar. And Rajanji has always been telling me about the scholarship in Maharashtra, the Maharashtra style of understanding Panchakarma, and the teachers of Panchakarma. Perhaps Rajanji will tell us a little more about the senior teachers who used to teach Panchakarma for free. You stay with them for a number of days. You don't pay anything. You stay with them and you learn how it is to be that. Rajanji, Pranamji, thank you for joining us.
हमारे जो गुरु थे पंचकर्म के वैद्य नाना जोशी दुलिया से, उनका वो अभी नहीं रहे, पर फिर भी उनका जो बेटा है, he is doing the tradition of Nana ji, because there are 20 students at a time with them, only to learn Panchakarma. Panchakarma सिखाते जो है वो literally from day one उनके हाथ में सब प्रोसीजर दिया जाता है. And his thinking was like that कि अगर पेशेंट को कुछ प्रॉब्लम हो गया तो वो आपको ढूंढते हुए बॉम्बे या किधर जम्मू वगैरह नहीं आएगा. He will catch me कि आपके यहाँ से एक प्रॉब्लम हो गया. तो उनका एक स्टाइल अलग था. तो सत्यवमन के बारे में उन्होंने एक सत्यवमन दे करके, एक जो वहाँ के बहुत बड़े रिच पर्सन थे, उन्होंने एक बहुत बड़ा हॉस्पिटल मालेगांव जैसे गांव में, कि जहाँ हैंडलूम का बहुत बड़ा बिजनेस है, मतलब हैंडलूम इज वहां से पूरे भारत में ही नहीं, आउटसाइड भी वहां से ये होता है, एक्सपोर्ट होता है। ऐसे जगह पे उन्होंने 20 बेडेड हॉस्पिटल पंचकर्मा का, और वो पूरे इंडिया में पहला चैरिटेबल पंचकर्मा हॉस्पिटल था, ओनली फॉर पंचकर्मा। और उन्होंने वो जो पेशेंट था, ही वॉज सफरिंग फ्रॉम ट्यूबरकुलोसिस, क्षय, तो he has taken 9 months of AKT and everything. He has traveled so many big cities for his treatment. But नाना ने एक ही सिर्फ सद्यवमन दिया, और उसमें क्या था, मदन फौल और सैंधव, बस उतना ही उनको दिया। He has, उन्होंने जो ये किया, जो पेशेंट ने, कि एटलीस्ट 1 बिग बाउल ऑफ कफ नेक्स्ट डे गिर गया, और बाद में उन्होंने उनको, उनका जो कहना था कि ब्लैंक चेक दे दिया कि आपने मुझे ठीक किया, तो ऐसे बाकी लोगों को भी बेनिफिट मिलने चाहिए, तो इसके लिए व्हाट टू डू। तो उन्होंने कहा मुझे कुछ नहीं चाहिए, ऐसा एक हॉस्पिटल मेरे दिमाग में है, चालू करना है, और वो उन्होंने शुरू किया। एंड एटलीस्ट उनके पास में रिकॉर्ड जो है, 1 लाख से ऊपर वमन उन्होंने दिए थे अलग अलग कंडीशंस में। और उनके पास कैसा रहता है कि जो भी स्टूडेंट सीखने के लिए जाता है, जैसा अभी मदन जी ने कहा कि वो फ्री ऑफ ये रहता है, सिर्फ जाते समय एक छोटा थीसिस या ऐसे के जैसा लिख करके उनको देना है कि मैंने ये 1 महीने में क्या क्या सीखा, और वो उसमें से सॉर्ट आउट करके जो अच्छा राइटिंग रहता है, वो महाराष्ट्र का जो सबसे बड़ा पब्लिशिंग ये है आयुर्वेद पत्रिका, उसमें वो पब्लिश करते हैं, वो स्टूडेंट के नाम से ही। ये भी एक उनका बहुत ही बड़ा ये है। तो इसके लिए हमारे अभी नाना नहीं रहे, पर उनका जो बेटा है प्रवीण जोशी, ये इज डूइंग सेम ट्रेडिशन। और थैंक यू, क्योंकि सत्यवमन के बारे में उनसे भी बहुत सुन चुका हूँ, और अभी जो मैडम ने कहा कि यस मोस्ट इफेक्टिव, ऐसा है। थैंक यू।
थैंक यू राजन जी, बहुत बहुत धन्यवाद। वी हैव टू कीप कनेक्ट। वो जो परंपरा है आपके महाराष्ट्र की, उसको रखनी चाहिए जी, उसको थोड़ा सा वैसे सीनियर लोग पकड़ के, वी हैव टू कीप दैट परंपरा। जैसे वी विल डिस्कस दिस बाद में। नवीन जी प्रणाम जी।
प्रणाम जी।
प्रणाम जी।
अभी मेरा आई जस्ट वांट
अगर
टू
नवीन जी हमारे साथ है 2 जने, शायद इनकी हिंदी थोड़ी कमजोर होगी, अगर अंग्रेजी में करें तो ठीक रहेगा। आई विल आस्क अनुराधा, आपकी हाउ इज योर, कैन यू अंडरस्टैंड हिंदी अनुराधा?
Better to communicate with English. I'm not much good in Hindi.
Not good in Hindi. Okay, so I want to just introduce Anuradha. I'm taking the liberty of introducing Naveen ji. Naveen ji is a senior Vaidya. He studied in Tibia College in New Delhi. And I am not embarrassed to say that he was the gold medalist for Delhi University at his time. And he learned Panchakarma in Kottakkal Ayurved Shala in Kottakkal. And he has since worked for almost 3 decades here in Europe in many, many places. And he is considered one of the best Panchakarma Vaidyas here in Europe. So together with Naveen ji, I have been discussing a little bit about Prameha and those kind of diabetes, type 2 diabetes in particular. And Naveen ji had asked a question. So the floor is Naveen ji. Namaskar. Thank you for Pranam ji. Thank you for joining us today.
Yes. So I don't want to take, sir, thank you very much, sir. I don't want to take the floor. I just raised the hand because I wanted to ask a question. Because what I know, few years ago, I came across with a student of mine who was studying Panchakarma under me. And then he told me that he was student of Dr. Gahukar in Maharashtra. Gahukar. So he was a Marathi boy. And
Gahukar. Yes. From Nagpur.
From Nagpur, yes. That's correct, Nagpur. So, so I heard a lot of good news about Dr. Gahukar. And second question is to you, Dr. Rajan Patankar ji, and that's why I raised hand. That will you please elaborate a little bit more about this? How the learned doctor came into how the learned doctor decided to go for Vamana in this Shaya patient, and what was the reason for that? And secondly, you used two ingredients, Sandhav Lavan you used, and you told me that you used
Madan Phal.
So will you please prescribe the dose? And Madan Phal, as far as I understand, we use Madan Phal Majja.
Yes, correct. Correct. Yes.
So that's correct then. So Madan Phal Majja was used. And can you tell me in how much quantity and how you wash it properly, and in which form you give this Majja?
Yes. In powder form, they used to give 3 grams of Madan Phal Majja and 1 gram of Saindhav.
Now my question is, I'm a little bit surprised to know that, because when it comes to Majja, then why it has to be in powder form? Why it is not just the Majja?
Okay. Because the place he was practicing was a very rural place. So that's why to administer it, उनका ऐसा ये करना था. He has to used to in powder form.
Because in the powder form, you will lose if you go to the Bhashajya Kalpana, and if you do things in Bhashajya Kalpana, you will understand that in powder form, the Madanji, also for you to know, in the powder form, the mucilage part, the mucus part of the herb is totally gone, because water content is gone, mucilage part is gone, and then when you say about rural, and then after a few days or few months, the effect of the powder, virya of the powder is also gone. So I want to understand it from the research point of view, which you are going to do in UK in future with the National Health Service here. In that case, we have to standardize all the treatments, and we have to be very sure. We cannot make the excuse of okay, I'm fine with the point of
Naveenji, I'm going to stop you here very briefly, because I want to bring into the floor Shrikant Peruguji, because he will bring the Hyderabad expertise, and also as medical superintendent of a big hospital, he will be able to tell us a little more. I take the liberty of just interrupting you very briefly. We got your question. Shrikantji, Namaskar.
Sir, namaste, all of you.
Namaste. I think you got Naveenji's question. Yeah. Thank you so much for joining us today, Shrikantji from Hyderabad.
Thank you. And Naveenji,
before I give you the floor, sir, I just want to add a little more. Shrikant Babuji's expertise is skin and related to hair, aspects of hair and skin in Ayurveda. Namaskar ji. Thank you for joining us today.
Sir, I'm happy to be with all of you. And the question, what I understood is, sir is asking about the standardization procedures of Panchakarma. Actually, Government of India decided to do standardization of Panchakarmas in 2006 onwards. Continuously, for 3 years, they have conducted interactive workshops and not seminars, interactive workshops to standardize each of the procedure. And this was conducted at Trivandrum in Kanaka Noru Palace or something.
Yes, sir. So,
yeah.
Shrikantji, if I just want to stop a little bit here. The question, I want to just refocus on Naveenji's question. The question is about Madanafal and why use the powder, or what Naveenji is saying, that there is a mucilage aspect that is lost if you use the powder.
Yeah. So that is only for the convenience sake. Actually, Naveenji's version is right there. If we get any fresh product like Panchvida Kashaya Kalpanas, we can use them as fresh as it is available. But in the areas where you need to store the medicine, you need to have other procedure to be adapted, preserve the medicine, and adapt the use it for the correct techniques. So in that way, Majja, it cannot be stored for more days. So naturally, they do bhavanas with that and they make it powder. So they do bhavana with kashayas, and that also been used actually. So only for the convenience sake, actually, textual reference supports for various modifications also there.
Thank you, Ji.
So there could be so solutions. There could be so many other solutions where we can preserve this majja as it is in some liquids. I absolutely don't agree with this that that for the convenience we can do like that. So because when we are dealing with with some studies, then we have to be very, very sure what we are using and the form. All the time we cannot run away from saying that it's freshness or not freshness. So we can preserve the freshness of anything which contains the mucilage part by putting them in a solution, and we have to find out the right solution for that, so that the solution does not do anything with the properties of the herb itself, and solution can rather intact the or could be a kind of a vehicle effect can give to the herb. So I think that will be nice to do that.
Sorry, Navinji, I interrupt you a little bit because we want to come back to that, to our two presenters. Your point is well noted that there is a possibility for innovation, is what you're saying. And perhaps
Yes.
the Panchakarma practitioners, and this is more of a research problem, I guess, maybe the National Institute for Panchakarma in Cherturthi might be encouraged to think a little bit more about this. But I want to hear from Anuradha ji on this one point, whether you have some experience, Anuradha ji.
No, sir. I'm just a fresher. I've completed post-graduation just last year. We didn't try any standardization procedure.
You haven't done any standard. Okay.
Sir,
Sorry.
can I add something to that?
Please, Shrikantji, please.
Yeah, Navinji, thank you for your expression. The research scenarios and clinical scenarios are two different entities. For a research scenario, the proposal, what you are telling that we need to preserve the material, and study purpose we can.
Why?
Navinji, let us hear.
Let him
Shrikantji,
please. Let Shrikantji complete his stand, because it's not a matter of prejudicing.
Yes.
You are standing with you. Had there been Amla itself is in a fullest, the thing is this, then one should not go on for the Chyawanprash preparation. This is not like that. If we start like doing this, it means we are lacking something different. Amla is wonderful, it is best. Then no need to go for Chyawan, no need to go for Trikatu. We are still preserving, we are still using the precious medicines in a different form as per the need, as per the availability, as per the seasonal availability, and as per the geographical availability. It's not a matter that we can go keeping pressure on the same in a particular point, as majja is very good. If majja is not available, then it can be protected, it can be preserved. 100 not, then 55% result will be there. So we should be practical, as Dr. Babuji saying that practical thing is different, research thing is different, and you just caught his tongue on this very sentence itself. It's not like that. It's a pleasant discussion, and we want to have some result out of this discussion. Thank you. Sorry for the interruption.
Shrikantji, the floor is back to you. Please continue.
Yeah, it is actually in a research scenario to assess the efficacy of majja and preserved techniques can be enhanced and studied, as doctor is mentioning there. But in a clinical scenario, it becomes very expensive and expeditive actually. So practitioners and end users, they need a compact formulation for a safe and comfortable application. So definitely that is the reason why Panchavida Kashaya Kalpanas are now modified, and we are using Ayurveda into capsules, syrups, and soft gels also. So this is a course of evolution, but need to preserve the fundamentals of the area, definitely. So for a research purpose, definitely we need a closed and compact study, but that cannot happen in a clinical open label scenarios. This is what I believe as working into researches and clinical scenarios as professor and HOD of medicine, where we deal huge lot of patients in government hospitals actually.
Shrikant Garu, please could you tell us a little bit about the volume of patients that you have in your hospital in Hyderabad?
So exactly the statistics I cannot say, but roughly every day we'll have at least 100 to around 100 patients presenting to the OPD, Kaya Chikitsa OPD.
And
so among
sir,
them, whatever the case needed, we do Vamana, and wherever it is needed, we go for different modalities of the procedures, Panchakarma procedures. Not exactly all the cases are exposed for Vamana or Sadhya Vamana as such.
Thank you,
So
sir.
in Tamakasvasas, we adapt like that. Most of the Tamakasvasa cases, we adapt Sadhya Vamana, and that too, basing on the eligibility criteria and other things, after adapting all those areas only.
Thank you, sir. Thank you for clarifying this point. I think what Naveenji is saying is that here in the National Health Service, I mean, you have, Shrikant Babuji, you have visited London, you were with us in Parliament also. And what from when you came to where we are today, is there is a new policy document here in UK between the two Prime Minister's offices on health, that one aspect is related to health. And I think Naveenji's point is to take our minds, both our presenters and everybody here and those who are listening online, to think about how to put some meat into those discussions that are going on between Government of India and the UK government, with an emphasis on bringing Ayurveda into the NHS. And I think what Naveenji is pushing us towards is to clarify how much standardization is needed, if we are losing something or whether we can gain something by listening to experiences from different places. I think that is what Naveenji is trying to point to. And I feel this kind of discussion will bring many more people together. And I'm so happy that you have joined us today. I hope many more of the medical superintendents of the hospitals are associated with the Ayurveda colleges will also join these kind of discussions, that will take us very deep into looking at this issue of standardizing so that we can engage with other governments very safely and show that we have a safe procedure. What Anuradha has shown us today is how safely they are doing. She gave one example of somebody who had drunk phenyl and how quickly she could clear the almost accidents and emergency situation, how they could clean this person up, and then followed with a simple gargle of Murivanna. So these are very special examples, and thank you, Anuradha, for enriching us with those kind of points.
Thank you, sir.
Thank you so much, because I'm sure you have many, many more such examples that you can offer us. And with a view to making a dialogue happen, you are doing this routinely, but when we come to the health service and we look at our hospitals here in the UK, we find that this information doesn't get transferred. What you are doing, what you have learned as a postgraduate, what you are doing in your daily practice, or what Professor Perugu is doing in Hyderabad, or what C.P. Sharmaji is doing in Bhopal in his practice, or Rajan Patagarji in Maharashtra, it is never heard here. So one of the key aims is to bring people together and talk to each other so that we listen to the experiences. And we are lucky to have Naveenji here, and we are trying hard to engage with the health service. Somewhere it will happen. But wonderful to see that there are so many people here with such incredible experience. I don't know if there is Ramadas ji, namaskaram. I don't know if you would like to add something. And I also have Parikshit, Devnath Parikshit ji, namaskar. Oh, Ramadas ji, namaskaram. Thank you. Namaskaram. Thank you for joining us from, I want to thank you for bringing to us Priyada from your college in Kollam.
Nirada also from my college only. She has done her BMS here. She was a rank holder here, and again she has done her PG in Government Ayurveda College, Trivandrum. There also she was a rank holder. She is also my student only. Priyada in postgraduate student, Anuradha in BMS student.
Anuradha, congrats. We are so fortunate in this platform to have all these rank holders and gold medalists from your institutions. Now, Naveenji was 1975 or 79 or 80 gold medalists from Delhi University. You are from, and there is Pavanji here, who's also similarly illustrious career from his college in Bhopal. So we are very fortunate. So there you are, Ramdasji.
Yes, sir. The discussion on the Santaya Sambhashana. Santaya Sambhashana, when you take, you know well that now we are going for NAC accreditation. You know that NAC accreditation is mainly concentrating on student-centered education, not teacher-centered education, not lecture-centered education. Skill-centered and discussion-centered, application-centered education is the thing that which is being promoted by NAC accreditation. NAC accreditation is one of the very compulsory accreditation now every university demands. So everybody is trying for that one. If you take Charaka Samhita, it's very clear that very open to the student. Every chapter in the beginning, the student is asking the question. The teacher has only responsibility to put somebody, again he will ask the question, he answers. It's not a narration of the class. Narrating the class is actually a boring class and it is overloaded class. But if the discussion comes, so Santaya Sambhashana in Vimanasthana is actually a very, very, very important thing for preparing the curriculum. How to promote this? NAC advises a lot. In addition to that one, if you take Charaga, centuries before, as you told, at that time, if he has such a thought in his mind, Atreya and Agnivesha, that discussion alone can bring the, you know, there are some secret he will tell. When you enter into the Sambhashana, the Guru keeps some knowledge secret in his mind. But during the discussion, when you open yourself more and more and more, he develops the faith in you and he opened the secret for you. This is one. And another place, when the argument is going on, to win, some of the secret of your knowledge will be coming out. See, here is the two notes are being opened. One is to protect the best knowledge, the Guru keep it in his mind unless and until he get the real faith in his students. Santaya Sambhashana is a best stage for clearing the Guru to get, yes, this Shishya is having very good knowledge. He will not misuse the knowledge and he has the clear logical thinking in him. So he gives that message for the student. Open the secret to him. This is a very positive approach. And another one is when an argument comes, to win, the secret will be told. The another 2 points she told is, there are so many doubts in every scholar. When it comes into a discussion, either directly or indirectly, your doubts will be clear. So we are conducting seminars. See, so many seminars we are conducting, so many journals we are publishing. But you see, they are not fulfilling what really the Santaya Sambhashana of all those days fulfilled for getting the knowledge and clearing the knowledge. That also, for conducting the seminar, also we need to develop the Santaya Sambhashana guidance in that place. Then again, your seminars will do the better things in the, just for competition. Now it is happening. What I found is many seminars are just for competition, first prize, second prize, third prize. Presentation of the papers, even very few only listening in that one. The group discussions are very rarely happens. So Santaya Sambhashana is giving us such a beautiful guidance for conducting seminars, conducting the classroom curriculum, how to plan it. Such a beautiful system that which gives. About Vamana, how not much knowledge in that one, but still the Nirukti when you take, Vamana, Vama Shabde is the one of the Dadu. She told Udgirane. Udgirana means bringing it out. Vama Shabde means that makes the sound results. And you know, it creates the sound that which comes from your lower abdomen. You know that when you wanted to produce a sound, it comes from your lower abdomen. So Vamana has an effect right from your lower abdomen to bring them up. Vama Shabde is the dhatu you can see in Shabda Kalpadruma. Karmani Luta Pratyaya. The process in which The sound that which comes from your lower abdomen, that means the things that which comes from your lower abdomen, like when you produce the sound. So that also is in the Vamana. And she mentioned, actually, it is good for COVID also, she mentioned, because
Yes.
Kapha is there. And actually the Visha, when we call it as Visha, Vishitati lokam tasmad Vishayiti sapnya, that is a nirukti of Visha. Actually, all these viral diseases develops this way or the other way, the Visha in our body. Visha is only Loka when you say Deham. Vishitati Deham iti, anything that which COVID, it affects your platelet, affects your blood quality, automatically it is acting like Vishavega only. So that terminology itself is giving us that it can be applicable for all these types of diseases according to the Sanskrit terminologies. This is what is I can say today. Thank you.
Ramadashi, thank you. But before we let you go, could you tell us a little more? We are always grateful for your clarification. It is so complete. And thank you. We are very, very grateful for this. Every time you offer us something, it has sounds so clear. So both very grateful for that. Namaskar. But before we let you go, you started off by saying about the NAC accreditation. Could you tell us a little more about and where we can find those regulations? Is it available somewhere online?
It is online, sir. Now it is online registration. If you wanted to get to the NAC accreditation, everything is online. Generally, they used to visit us. Now it is purely online. If you go to the NAC site, you will get everything, how to start it. You have 2-3 steps are there. Everything is very perfectly, very clearly told in the NAC site, sir.
Thank you.
We are now having A+, NAC A+ for our university.
NAC A+. Thank you so much for highlighting this point about NAC accreditation, because as far as I know, Professor Bhushan Patwardhan, a good well-wisher for all of us here on the program, I think he is now the chair of the NAC accreditation board, if I remember correctly. I think we will confirm this, but my feeling is, but thank you so much for mentioning that aspect about skills. Thank you also for pointing out that if you look at Charaka Samhita, it gives you the model for teaching, which is the student is asking the question and it is being replied. And what we are saying is we need to bring back the spirit of that.
Yes, sir. It is missing now. It is missing. We are all going for dictatorship classes. We go, we present, we teach. No questions are coming. Even I tried, I gave the topic to them 1 week before. You bring some questions, that will be easy for me to run the subject. But you know, that habit is not there. That's why they are not coming forward. How to refine them? It's a big question in front of the
I think you are touching the key points here about education reforms, a new style of getting our youngsters to engage with this, which Pandeji was mentioning yesterday. If you recollect Pandeji from Prayagraj, he was mentioning yesterday that in their time, there were teachers and there were gurus. And the gurus somehow made students interact more easily.
Yes,
a teacher is a more serious person. A guru was an enlightened person who knew the answers to many, or everything that the students were interested in. And this, like a grandfather, a grandmother kind of figure, you know.
Yes, sir.
And the students could feel free to talk to them.
Yeah.
We need to bring that spirit back into our education system somewhere, where students don't feel frightened about this one person.
Yes, sir.
They can go and ask any question.
Yes, sir.
And I think every institution must have a few people like that, who will, students feel they are at the same level and they can talk, ask any question instead of this formal classroom setting.
Yes, sir.
These are all lessons from Charaka Samhita. And I want to thank Pavanji for bringing us all together. I keep repeating this, but without that effort, these discussions will not happen. And for us to revisit the spirit and the mood of Charaka Samhita from the early days to where we are today. Nilakshi Dev Chaudhary. Nilakshi ji, namaskar. Thank you for joining from Jorhat. Your question, please.
Sir, thank you, sir. Sir, I had a query like Vaman. Sometimes there may be complications. Supposing a patient is having vomiting and repeated vomiting is there, and how to control the vomiting? Means regarding the cases where we are doing Vaman.
Nilakshi ji, I think Anuradha ji is here still with us, and she might be the best person to take this question. And perhaps also Agnihotri ji will comment on this question. But thank you for this question. Also, Shrikant ji is here with us. He will also. But I give the floor to Anuradha ji. Anuradha ji, I hope you got the question.
Yes, sir, I got the question. So basically, in Ati Yoga, Stambhana is the treatment principle you have to adopt. The simple way is just pour Shita Jala over his face and head. Just Shita Jala Parisheka is the best option, which is the prime line of Stambhana. That will automatically reduce the Vegas actually. And also, when you can make the patient to lie down with raising his legs so that his BP would be also in a controlled level, and his blood circulation, his venous circulation will also be enhanced. That is a basic first treatment you can give. It's not a treatment, in fact, it's a basic step you can adopt.
Meenakshi ji, I don't know if that is that satisfactory. I don't know, Agnihotri ji might want to add something here, or Sharma ji might want to add something here. Meenakshi ji, does that answer your question?
Yes, sir. That means I feel that means the vomiting center, I think it relaxes the vomiting center and it will reduce the Vegas. Yeah.
I think Agnihotri ji might want to add a little bit here.
I think Professor
C.P. Sharma ji will.
Yeah, he has joined.
Sharma ji, pranam ji.
Sir, pranam sir.
Namaskar ji, namaskar, pranam ji.
Namaskar.
डॉक्टर साहब, ये एक सवाल मीनाक्षी जी का वो सवाल जी थोड़ा उसके वहां से अगर शुरू करके बाकी आपसे सुने जी दोनों हमारी प्रश्न।
तो प्रश्न का जो उसका जवाब है सर,
हाँ जी,
वो ये है, एक तो आप अभी बताया शीतल जल का प्रक्षेप, और हमें जब भी कभी ऐसा हुआ और हमने उसमें स्वर्ण सूर्यशेखर और अभिपत्तिकर शहद के साथ चटाया, कई बार इसके बाद भी उसका फ्रीक्वेंटली वमन हो रहा है, तो उस स्थिति में हमने अभिपत्ति का चूर्ण को आइसक्रीम में मिला के भी चटाया और बहुत अच्छे रिजल्ट मिले। तो ये इसको अति योग कहा है हमारे आयुर्वेद में, इसको अति योग, जहाँ इस स्थिति में हमारे जो अम्ल पित्त की चिकित्सा है वो इसमें प्रभावी रहती है। पित्त सामक चिकित्सा, पित्त शीतल जल का उष्ण जल, पानी गर्म करके फिर ठंडा कर लो और वो भी पिला सकते, नारियल का पानी भी पिला सकते। तो ये हमारे पास जो भी उस समय बेस्ट रेमेडी है हमारी उस समय हमारी व्यवस्था में, वो अपन यूज कर सकते। अब रही बात वमन की, तो ये बात आ रही थी अभी बीच में कि मदन,
एक मिनट डॉक्टर साहब, हमारे साथ है जी साउथ से काफी लोग, अनुराधा जी है, प्रिया जी है, श्रीकांत बाबू जी है, शायद श्रीकांत जी इज फ्लुएंट इन हिंदी। खाली प्रियदा, आपकी हिंदी कैसे जी? कैन यू अंडरस्टैंड हिंदी प्रियदा?
Sir, little only.
Little only. Anuradha, do you understand Hindi? Little bit or zero?
सर सूर्यशेखर ये हमारा क्लासिकल टेक्सुअली रेफरेंस प्रिपरेशन है।
अच्छा जी।
स्वर्ण सूर्यशेखर, अभिपत्तिकर चूर्ण और हनी, शहद को हनी कहते हैं हम।
बिल्कुल जी।
नो प्रॉब्लम अबाउट लैंग्वेज। ये बाकी यदि ऐसा कुछ लग रहा है तो ट्राई टू एक्सप्लेन इन इंग्लिश।
नहीं जी, आई जस्ट वांटेड टू जस्ट से कि हमारे पास है लोग बाग। नहीं डॉक्टर साहब, प्लीज कंटिन्यू जी। वो जो
हाँ, तो ये सब जो अति योग हो रहा था, जो ये डॉक्टर दिल्ली वाले कौन से तिबिया के डॉक्टर साहब थे, उन्होंने मदन फल मज्जा के ऊपर की,
हाँ जी, नवीन जी गुप्ता जी।
हमें जब मदन फल पिपली का यूज हमारे टेक्स्ट में रेफरेंस है सर, मदन फल पिपली।
अच्छा जी।
उस मदन फल पिपली की यदि हमें पोटेंसी बढ़ाना है, हमारे पास पेशेंट के अकॉर्डिंग टू पेशेंट हम देह बल, अग्नि बल और दोष बल एज वेल एज कोष्ठ, क्रूरो, मृदुर, मध्यम, मध्य। तो कोष्ठ कैसा है रोगी का, दोष बल जो जिस दोष से रोग है, मतलब कफ की मात्रा का क्या स्थिति है, कफ प्रकृति परीक्षा जब हम करेंगे या रोगी की जब परीक्षा करेंगे, उस स्थिति में यदि कफज ज्यादा है, प्राबल्य है कफ का, कफ मोर एंड मोर जो कफ बढ़ा हुआ है, उस स्थिति में हमें यदि मदन फल पिप्पली देना है, तो उस मदन फल में हमारे वैद्य का काम है कि मदन फल पिप्पली का चूर्ण रात को एक कुल्हड़ में गलाए और इस मदन फल चूर्ण में उसका मर्दन करे, मर्दनम गुणवर्धनम, तो उसकी 45 पोटेंसी हो जाती है, फोर्ट हो जाती है, मल्टी पावरफुल होती है। ऐसी स्थिति में जब हमें मालूम है कि मेदस्वी पेशेंट है, स्थौल्य वाला पेशेंट है, जिसकी मेदोअग्नि दुष्ट है, जिसका मंदाग्नि बहुत ज्यादा है, कफ जन्य अग्नि है, तो इस स्थिति में हमें यदि मदन फल पिप्पली या मदन फल की जो पोटेंसी है वो यदि बढ़ाना है, तो मदन फल में मदन फल की भावना दे सकते हैं। हमारे यहाँ इसको भावना कहा जाता है, घोंटा जाता है, ऐसा अपन बना के रख सकते हैं कफज रोगियों के लिए। फिर देह, उसकी बॉडी कैसी है, रचना संरचना कॉन्स्टिट्यूशन, उसका कॉन्स्टिट्यूशन कैसा है। अग्नि माने हमारा, जिसको हमारे यहाँ पित्त कहा है, अग्नि यदि कफज रोग है और उसकी अग्नि तीक्ष्ण है, तो हमें ज्यादा मेहनत नहीं करना पड़ेगा, हमारा द्रव्य जल्दी काम आएगा। दोष बल, दोष का, ऐसे दोष के जो गुण हैं, रुक्ष, शीतो, लघु, सूक्ष्म, सल, विशद, खर, ये बात के गुण हैं। इन बात के गुणों में कितने गुण प्रभावित हैं, इफेक्टेड हैं, उसको हमारे यहाँ अंशांश कल्पना कहा। उसकी अंशांश कल्पना के अनुसार दोष का अंश कितना प्रभावित है, कितना इफेक्टेड है, ऐसे ही कफ के दोषों का, कफ के अंशों की कल्पना करके उस अंश के अनुसार अपन डोज तैयार कर। हमारे यहाँ 2 तरह के योग बताए सर, 2 तरह की व्यवस्थाएं। एक तो वामक द्रव्य जो वॉमिटिंग के लिए हम देते हैं, वमन कराने के लिए, दैट इज नोन एज वामक द्रव्य। उसमें जैसे बचा है, मदन फल है, सेंधव है, इसको चूंकि पेशेंट पी नहीं पा रहा है, उसको इंटेक नहीं कर पा रहा है, तो हम उसमें शहद भी मिलाते हैं और उसका इरिटेशन कम करने के लिए बचा मिला देते। तो जो आ रही थी कि अभी हमारा जो वॉमिटिंग सेंटर है वो हाईली बहुत ज्यादा एक्साइट नहीं हो जाए, इसके लिए बचा और मुलेठी हमारी, तो जो हम इसको साथ में, एक होता है वामक द्रव्य, एक वमनोपक, माने रोगी ने वामक द्रव्य का सेवन कर लिया, अब उल्टी नहीं आ रही, उसको वमन नहीं हो रहा, वॉमिट नहीं हो रहा, तो उसके लिए हमारे यहाँ आचार्य चरक कहते हैं वमनोपक द्रव्य का क्वाथ, काढ़ा बना के लिक्विड फॉर्म में, जिसमें उन्होंने मुलेठी बताई, दूध बताया और लवण बताया, और कवोष्ण जल के साथ इसका यदि सेवन करेंगे तो जो फ्रीक्वेंसी है वो बढ़ जाएगी। हमारा पर्पज है कि इतने बेग आना चाहिए, नंबर ऑफ वॉमिट इतनी हो, उसकी मात्रा इतनी वॉमिट हो जाना चाहिए, और फिर उसमें एक कार्डिनल साइन बताया कि पित्तांते, जब वो पित्त आ जाए, मतलब मुख कड़वा होने लगे वमन करते करते रोगी का, तो वहां रोगी वमन को रुक जाना चाहिए, पित्तांते। ऐसे ही कफांते विरेचन, जब विरेचन कराते हैं उसमें कफ आ जाना चाहिए, म्यूकस निकलने चाहिए उसके स्टूल के साथ। तो ये हमारे जो कार्डिनल साइन हमारे क्लासिकल टेक्स्ट में एक्सप्लेन्ड हैं, उनको हमारे वैद्य को और हमारे छात्र को, जो भी छात्र या जो उसके हमारे एसोसिएट टीचर्स हैं, उनको ये सब चीजों को बारीकी से ऑब्जर्व करना। उस स्थिति में हम कोई भी कॉम्प्लिकेशन से प्रभावित नहीं हो, और वो कॉम्प्लिकेशन हमारे नहीं हो। फिर भी कई बार क्या होता है, पेशेंट ऐसा आ जाता है, जैसे हमें पूर्व उसकी तैयारी करनी होती है, उसमें वो माल प्रैक्टिस करता है, उस स्थिति में ओवर वो होने लगती है वॉमिटिंग, तो वहाँ डिहाइड्रेशन के चांसेस होने लगती है। तो हमें कुछ नहीं है, एंटीएमेटिक इंजेक्शन लगाएंगे हम, उसको ड्रिप लगाना है तो लगाएंगे, क्योंकि वहां लाइफ सेविंग की बात आती है। वहां हमें क्या करना है, पहले उसका जीवन बचाना है, फिर हमारे प्रोसीजर तो कंटिन्यू बने रहे। तो मेरा तो यही है सर कि अग्नि की देह, उसका रोगी का देह बल कैसा है, उसकी अग्नि कैसी है, उसका दोष कैसा है और उसका कोष्ठ कैसा है। यदि मृदु कोष्ठ वाला है तो लेसर डोज की जरूरत पड़ेगी, लेसर डोज। यदि मध्यम कोष्ठ है तो मीडियम उसकी क्वांटिटी चाहिए। क्रूर कोष्ठी में ज्यादा जरूरत पड़ेगी, मैक्सिमम उसका डोज अपन रिलीज कर सकते हैं, उससे कोई कॉम्प्लिकेशन। जैसे वमन के विरेचन के लिए है, ऐसे वमन में भी कफ से संबंधित, कफ का जो हमारा मेन पर्पज है, जो हमारी लाइन क्लासिकल जो हमारे रेफरेंस है उसमें कहा कफ विरेचन के लिए श्रेष्ठ। पित्त, ऐसे एक एक द्रव्य भी बताए। तैल वात प्रशमानाम श्रेष्ठ, सर्पी पित्त प्रशमानाम श्रेष्ठ। सर्पी माने घी होता है, ग्रथ, उसमें भी गाय का घी माना है। तैल वात प्रशमानाम सर्पी और मधु श्लेष्मग्नाना। तो हम जो शहद मिला रहे हैं वो शहद हमारा उसको वहां चिपका नहीं रहने देगा। कफ जब तक वहां चिपका रहेगा तब तो वो इरिटेशन करता रहेगा। तो हम उसे इजी गोइंग वहां से रिलीज कराएं, वहां से हटाएं। तो हमारा मदन फल क्या कर रहा है, तीक्ष्णता के कारण वहां जाके उसको पेनिट्रेट करेगा, कफ को छेदन करेगा, वेदन करेगा और लेखन करेगा। तो ये सब जो हमारे द्रव्य गुण, रस शास्त्र और हमारी जो क्लिनिकली स्टडी है उसमें हमें बच्चों को सिद्धांततः ये सब बातें कि छेदन क्या है, लेखन क्या है, वमनोपक क्या है, वमन क्या है, ये जो हमारे टर्मिनोलॉजी है, इसे वमनोपक माने उसको मोटिवेट करने वाला। तो ये सब चीजें हमें बच्चे को अच्छी तरह से, और फिर उसको दिखाना चाहिए, देखो हमने मुलेठी का पानी पिला दिया, इसको मुलेठी काढ़ा पिला दिया, उसका वमन शांत हो गया। अब मुझे एक ही वमन कराना है, मुझे उसको एक पर्टिकुलर इतनी मात्रा निकल जाए, ऐसा है। तो जो अभी एक क्षय के रोगी की बात आ रही थी, टीवी वाले की, जब उसको एक वमन हुआ उसमें उसका कफ इतना निकल गया कि उसका पूरा का पूरा श्वसन संस्थान क्लियर हो गया, तो रोगी को लाभ मिल गया। तो रोगी को लाभ मिला तो इतना सुकून मिला। जैसे हमारी विद्या में कहा है कि भाई हमें कहाँ कहाँ क्या क्या लाभ होगा, एक वैद्य को क्या क्या, तो क्वचिन यश, तो वहां यश मिला उसको। तो क्वचिन अर्थ, वो सेठ जी इतने प्रभावित हो गए कि उन्होंने पैसा दे दिया कि 20 बेडेड हॉस्पिटल बना। क्वचिन धर्म, क्वचिन कर्माभ्यास, कहीं हमारा एक्सपीरियंस होगा। चिकित्सा नास्ति निष्फला, चिकित्सा कभी निष्फल नहीं होगी। क्वचिन मैत्री, कहीं हमारी कलेक्टर साहब का हमने इलाज कर दिया, दोस्ती हो जाएगी। क्वचिन मैत्री, क्वचिन कर्माभ्यास, क्वचिन यश, क्वचिन अर्थ, क्वचिन धर्म, ये समझ के कि हम डॉक्टर हैं तो हमें तो इलाज करना है। तो ये हमारी वो है। तो इस तरह से सर ये छोटा सा मैंने बताया कि बचा मिला सकते हो आप। मदन फल है तो बचा 2 ग्राम मिला लो, 4 ग्राम 3 ग्राम मदन फल ले लो, 5 ग्राम सेंधव मिला लो और 15 ml शहद मिला लो, तो ये हमारा पामक द्रव्य बनेगा। फिर वमनोपक बनाना है तो यष्टि, मधु यष्टि जिसे कहते हैं मुलेठी, उस मुलेठी का काढ़ा दे सकते हैं आप, दूध दे सकते हैं। उसमें और ज्यादा वमनोपक करना है, जल्दी उल्टी कराना है तो उसमें लवण मिला दें। तो हमारा जो प्रैक्टिकल रिजल्ट ओरिएंटेड क्लिनिकल अप्रोच होना चाहिए, ये पर्पज है। रिजल्ट जिस पर्पज से हमें वमन कराना है, वमन श्लेष्माणाम श्रेष्ठ, विरेचन पित्ताणाम श्रेष्ठ, बस्ती वातावरणाम श्रेष्ठ। तो हमारा तो टेक्स्ट इतना क्लियर कह रहा है सर कि हमें किस दोष का इलाज करना है, किस दोष की व्याधि का इलाज करना है, उसके लिए हमें अपने पैरामीटर्स डिसाइड करना है। हमें उसकी पूरी कार्डिनल साइंस मालूम होना चाहिए और उसकी पूरी की पूरी फिजियोलॉजी, और प्लस कहाँ से कहाँ, जब गॉल ब्लैडर से जी सर
हो गया। मैंने नहीं, एक और बात ध्यान में आ गई, और
जी सर, और
वेबिनार ISER पवन कुमाराय नाम श्रेष्ठ।
ये सर ये पवन जी का सौभाग्य है, पवन जी का
ये चरक का संस्कार होता रहता है। चरक में एडिक्शन के तौर पर वेबिनार ISER पवन कुमार राय श्रेष्ठ।
धन्यवाद सर। नमो नमः, सर्वेभ्यो नमो नमः। ओके सर, ओके सर।
नमस्कार जी, थैंक यू। आपकी वेरी क्लियर एक्सप्लेनेशन डॉक्टर साहब, बहुत बहुत धन्यवाद।
और मैं कोशिश करूंगा सर कुछ दिनों में अंग्रेजी भी सीख लूं धीरे धीरे।
डॉक्टर साहब यहाँ तो बज गया 6:20, शायद आपके वहाँ तो
समय बहुत हो रहा है, 11 बज रहा है। 11 बजे।
आई वांट टू पवन जी और अग्निहोत्री जी, आप लोगों से परमिशन लेके, श्रीकांत बाबू से परमिशन लेके, आई वांट टू ड्रॉ दिस इवेंट टू अ क्लोज।
यस सर।
बट अग्निहोत्री जी, बिफोर आई pass the floor to Pavan ji to pass it on to yourself, I want to thank Rajan ji की तरफ से एक कमेंट है। राजन जी नमस्कार।
शर्मा जी बहुत ही अच्छा एक्सप्लेन किया। महाराष्ट्र में इक्षु रस का भी उपयोग करते हैं।
जी सर, बिल्कुल 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 सर,
बिल्कुल। वेरी वेरी वेल एक्सप्लेन, थैंक यू। और मैं एक कॉलेज में एज ए कमिटी मेंबर हूँ, वहाँ पे हम लोग 20 दिन का पंचकर्म वर्कशॉप लेते हैं और उसमें हर कर्म, हर एक जो भी पार्टिसिपेंट रहता है उसको करने के लिए मिलता है, इंक्लूडिंग उत्तर बस्ती भी, मेल फीमेल। तो ऐसा हम लोग 20 दिन का प्रोग्राम लेते हैं।
महाराष्ट्र में सर शुगर फैक्ट्रियां ज्यादा हैं, बहुत जल्दी मिल जाता है, हमारे यहाँ उपलब्धता कम रहती है।
यूपी में बहुत है, यूपी
में भी है।
शर्मा जी आपको भी एक बार बुलाएंगे जरूर लेक्चर के लिए।
मेरा सौभाग्य रहेगा सर।
नहीं जरूर 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 जरूर
सर, थैंक यू सो मच सर।
शर्मा जी बहुत बहुत धन्यवाद जी। और आई वांट टू थैंक नीलाक्षी जी, श्रीकांत गुरुजी।
Sir, sorry to interrupt you. One small information, addition of information.
Please.
One instrument for got a patent for conducting Vamana actually. This is called Advanced Automated System or Instrument for Therapeutic Emesis. So this has been done by one of my close friend and classmate. So he got patent for this. It is equipped with all the ECG monitoring, SpO2, fluid levels, temperatures, everything. So this is a addition of information I would like to share, as this is
how much cost now? How much cost, sir?
It is not into market, sir. Just now, just few days back, he got the patent, and it need to be released to the market very soon.
सर जी possible उनका contact number अगर provide करेंगे तो
sir I'll share it to the Madan ji so that he can share the details of patents. I have the certificate also. He is my classmate actually. Presently he is working as president for Board of Ayurveda NCISM, Dr. B. Srinivas Prasad.
Okay. अच्छा.
So we from Tirupati College and Mysore College, we are good at the instrumentization, designing and researches actually. So that is really good, sir. I can send you some information on that to Madan sir. Madan sir will in turn circulate, sir. Thank you.
Shrikant Garu, thank you so much for being with us. Only one request.
Sir.
Please keep joining us as frequently as you can.
Sure, sir. Sure, I'll
that
try.
Is the only request I have. Yeah, because you bring that scholarship from Telangana and Andhra Pradesh, and we have Domaji here also from Telangana. So we are lucky that there are senior people here who will bring that perspective from Andhra, the old Andhra region, where there is a lot of expertise, like we saw in today's webinar earlier today. Thank you, Ji. Bahut bahut dhanyawad.
Thank you. Sir.
Please continue to encourage, number one, please encourage your staff members, students to join us in our programs that Pavanji puts together with great care and love. And we would like very much your help also, suggestions from Andhra, Telangana speakers who can come to our platform and enrich our platform. Thank you
Sure.
so much.
Sure, sir.
So before I give the floor back to Pavanji and to Agnihotriji, I want to particularly thank Anuradhaji and Priyada and Ramadas ji for sharing, for being here with us today. Priyada, Valda Sandosham, thank you for being here with us. I will connect on by WhatsApp. Thank you for sharing your details. We could continue. Priyada, I can see you are feeling sleepy already. Our discussions can go on for another 2 or 3 hours because we are so full of energy. We can keep talking about all important things. So please join us again.
Sure,
Please
sir.
bring
Thanks.
more students from Amrita College to come and join us and participate in our discussions. You
Yes,
can
sir.
see how late we are sitting. Generally, our discussions go on for many hours. So we want to see more young people doing this, engaging and taking us forward. Thank you very much, Priyada. And thank you, Anuradha, for joining us today from Trichy. We want to learn more about the expertise that is there in Tamil Nadu, not only for Ayurveda, but also some of the Siddha understanding. I think you might even know some Siddha practitioners, and we want to learn from them also, but we find it difficult to draw them into our platform. But maybe you can be our leader there in Trichy to bring many more people into our platform. A big thanks from me and from everybody here and from our listeners to both of you for this wonderful presentation today. And there will be many questions that will come later on. Namaste.
Namaste.
Namaste. I leave the floor to Pavanji. Pavanji is here. Otherwise, with Pavanji's permission, I request Agnihotriji to take us forward. Agnihotriji, Pranamji.
Pranam, sir. Thank you, sir. Actually, it's not a simply a tradition or customary or say formality. It's a fact that we are day by day getting more and more matured, experienced, knowledge, and the today's pleasure is this, that our webinar or our platform has now started joining by the very young persons also, research scholar and then students. So it's a great pleasure because the soul of a student is coming forward in the terms of these newcomers. And in this way today, we also, our IRES webinar series is stepped in by one more score. So this is a real continuous establishment which is getting more and more firm and incorporating a lot of new faces and new knowledge under our umbrella. So this is what our efforts, and they are getting in a fruit form. As far as today's guest speakers are concerned, they made all justice by their presentation, and really they touched that area which is to be raised in real sense by the students. Because Samabhasha Parishad, Samvad, Gyan, Vitandavad, Vitark, Gyan Buddhi, and Parikshan, these are things that the essential components of the say studies and knowledge. So these our guest speakers, especially Dr. Piyada, is projected this thing. And I'm sorry that there may be any problem as far as the Hindi speakers persons are concerned, but still Ayurveda, since it is written in Sanskrit, so a person who can understand Sanskrit may understand Hindi also up to 75%, if not 100%. So it may be a difficulty, because I had been a very good friend of mine from South India, Andhra, Karnataka, Kerala. So that is no problem. With the due course of time, you will get the theme. And important factor is this, that as I've told you earlier also to this platform, that in real sense, what is fashion adopted in Charak Samhita was the tradition of our Guruji also. Professor S.C. Shukla ji in BHU always in his first or second lecture asked all the 20 students, we were 20 in medical MD students, all the 20 students, that you put 10 questions on a paper, whatever the doubts you had been keeping by now during your undergraduate study of any subject, any doubt. If you do it, it means you have read these 15 subjects, and we will take up by roll number every student's that 10 questions slip throughout our 1 year in MD first year, and total MD 20 students will be benefited. This is his pattern to teach, and really we appreciate. And for that, we used to take that it cannot be copied from any student. What is your question? That question I cannot ask. So there is no use of taking any help or copy. So it was such a great examination that if you have read properly, you will. It is very hard to put questions. Apart from getting answers, so 10 questions from one student was say 200 questions throughout the tenure. It becomes a syllabus. So that was the pattern. Bhadrika Patreya, Maitreya, Atreya, Agnishu, or Atre discussions. Everything was in the same manner. Well, and second one is presented on Vamana Karma. Vamana Karma, one of the karma in under our Panchakarma. So in that way, they are repeatedly putting the same thing. We have to see that for which patient it was indicated and it was performed with the help of any of the say woman stimulating say powder, say Madanfal or Sanjanaman or whatever, is giving the full result or not. So this is what we can say the ongoing say shortcomings. This is an ongoing shortcoming, and we clearly mention it as what precautions we have to take and what management we have to take in a spontaneous manner as a pratutpannamati, because that is the patient is under treatment. He cannot be put under sufferings. We have to take out any best possible remedy for him. So Pittantak Vaman is important, Shleshwantak Vaman, and then if it is taken Atiyog, it may go to the Raktantak Vaman. So one should be very careful. A patient who is having already gastric ulcer or any hyperacidity, they should be avoided for Vaman. That's why Arya and Anarya, to whom it is indicated in Trudumna, it is the best possible, our Panchakama specialist who is having expertise, he will decide that which of the kam is indicated. And that's why Isneen Swadan as a Purukam is equally important. That's why the one precautionary manner is this, that the Isneen Swadan is to be done. So all greetings to our guest speakers, and what we left in early our discussion. We have to pay our regards and respect to all the senior dignitaries who joined today's webinar, and they are our respects to Professor Madan Thangveluji, Professor B.R. Sharma Sahab, B.P. Sharma Sahab, Professor Ram Tirth Ji, Vaidya Tapan Kumar Vaidya Ji, Dr. C.P. Sharma Ji, Dr. Jagdish Doma Ji, Professor Ramdas Ji, Vaidya Parul Joshi, Miss Momita Sharma Ji, Dr. Rampal Somani Ji, or then our this Dr. Parikshit Devnath Ji, Dr. Naveen Vaidya Naveen Kumar Gupta Ji, our Shrikant Babu Ji, and our Tejinder Singh Ji. These all were our persons present. It was at almost 18 to 20, and still we are having 14. So today's decision, attendance wise, is very vital. And where the Rajan Patangaji is very much, he has not only remained till now, but also actively participated in discussion, will along with his inputs that how he is performing. And I am just near to you. It will be a pleasure that on any day I will be visiting you, sir. Definitely. Moreover, welcome. Thank you. I told you earlier that it will be. I have made a point to see you because your Sukshma Aushadhiya is a really great information to us all. So if any big guy's name I wouldn't taken. One with a matter of query or pleasure. One Thangvelu daughter has also joined. I've written something, but
that is my Agnihotriji, that is my younger sister joining from California.
Oh yes, I think she came to you for Raksha Bandhan, and in this way, seeing you involved in webinar, she also joined. So when she joined, it was under running either your daughter or your very close person. So I thought that I'll take this point to put forward. So my all greetings and my namaskar to her also. And this is very, very good. Yes, sir. Yes, sir.
नाना जी का और एक पॉइंट कहना मैं भूल गया कि वो पंचकर्म सिखाने के पहले उसके उपद्रव सिखाते थे और बाद में पंचकर्म. हाँ,
great. That is very important.
यस, पहले उपद्रव सीखो, बाद में पंचकर्म सीखो, ऐसा उनका लॉजिक था.
बिल्कुल. उस समय तो बड़ा मुश्किल हो जाएगा. डॉक्टर, फिजिशियन ऑन ड्यूटी नर्वस हो जाएगा. He will starting perspirating what should I do, because every time teachers and Guruji are not there. So this is very important. We always read the experiment in writing, in theory, along with the prescription. Then we go for in lab to do it.
Correct.
So thank you so much. With all these words, I pay our respect to all our persons, and thanks to our guest speaker. Thank you so much.
Thank you, Agnihotriji. नमस्कार. शिवरात्रि. आपके तो 11 बज गया.
11 बज गया.
नमस्कार.
अब बच्चों, हमको अपने यंग गेस्ट स्पीकर तो बहुत तहे दिल से very much greetings and congratulations. Please do join and put your details in our chat box so that we can contact you as and when we are in need of, and we extend our good wishes that you please go high and high. And continue this sort of training and learning to your students, that how the Ayurveda can be read in a better way. This is what I want to say. Thank you.
Agnihotriji, Shivaratri.
Shivaratri. आप लोगों को प्रणाम.
प्रणाम जी. प्रियदा, बहुत thank you. വളരെ സന്തോഷം. ഞാൻ മലയാളത്തിൽ സംസാരിക്കട്ടെ കുറച്ച്. മലയാളം അറിയാം. தமிழ் தெரியும் எனக்கு. அனுராதா, தமிழ் பேசுமா?
தமிழ் தெரியும்.
தமிழும் பேசும் கொஞ்சம்.
లింగల్ని పేరు ఏందు? I think some Malayalam I do remember. లింగల్ని పేరు ఏందు?
Anyway, thank you all for such a wonderful session. Both. And your Priyada, we have enjoyed it very much. We want to thank your teachers, particularly Ramadas ji. Both of you teachers. Ramadas ji is very special to us. And every time he's there, we learn so much. Every day he's giving us new idea. Today was about NAC accreditation and skills and all these things. It's very, very important for the future. Good night, everybody, Priyada. And Agnihotriji, I hope everything goes well for your move on the 14th. Yes. Now that your daughter is going to be in Pune, you will be connected to Maharashtra school. The paramparas are so important for us,
Yes, I am very much interested to. That's why I am very much interested to go for this Pune Vidyapit or any.
Yes.
I am not having direct links, but I do hope that it will be channelized within time. Today I visited that society where she has taken that flat from our Western hotel. And after tomorrow or something, as soon as the truck carrier will come, we will get it down, loaded, and then we will shift there.
Agnihotriji, in the past decade, I have been trying very hard to convince our Vaidya friends in Pune that Pune is the world capital for Ayurveda. At any one time, Pune city and its surrounds has more than 4,500 to 5,000 Ayurveda students. They don't seem to understand the significance of this. Yes. And I raise this again in this public forum, once again, that there is one city in the world where you can go anytime and there will be at least 4,500 to 5,000 Ayurveda students. And our Pune wale don't understand this. What can we do? And
Dr.
I leave-
Jamdagni also in Pune, sir.
हाँ जी,
पर
डॉक्टर
कैसा है
जमदग्नि।
सर जी कि जैसे हम लोग दश दिशा बोलते हैं तो वैसे हर एक का एक एक विद्यापीठ है, तो इसके लिए कोई भी इकट्ठा आने के लिए
तैयार नहीं है।
ओह, this is the ego problem.
इसमें कौन सा कर्म लगाएंगे जी?
षट कर्म. पंचकर्म are failed, so we have to go for षट कर्म.
इसमें अलग सा कुछ करना पड़ेगा कर्म. कैसे ले आए लोगों को एक साथ?
वेरी डिफिकल्ट,
वेरी डिफिकल्ट.
एक बार ऐसा ट्रायल हो गया था, पर स्टिल वेरी डिफिकल्ट.
कोई नहीं जी, we have youngsters like our Priya and Anuradha who are equally excited and will guide us in the future.
Definitely.
शर्मा जी.
सर नमस्कार.
शुभरात्रि जी.
है कोई कर्म आपके पास?
नहीं
जी सर.
आप तो एडमिनिस्ट्रेटर भी रहे, आपके पास कोई कर्म टू यूनाइट आयुर्वेदा just to weigh the frogs like that?
वो ये हो सकता है सर, जिसका
मेढक तोलने के बराबर वाली बात हो रही है.
जिसका जो इंटरेस्ट है उस टॉपिक में जरूर जोड़े उनको, इंटरेस्टिंग सब्जेक्ट में उस व्यक्ति को प्रयास हो.
We want to unite the tradition of Pune, as sir is talking about, that the ages long tradition of Ayurveda in Pune, which rests so many decades back, and there had been countable students, say 4,000 to 4,500. So that instinct, if it is get united, a very good output will be from there, and it may stand parallel to Jamnagar or any center of Ayurveda.
अग्निहोत्री आप ट्राई कर सकते हो. मैं कुछ
I am a far off placed person. I am a very far off placed person. How can I even just counting? I just taking names of you from you people itself.
We are lucky, Agnihotri ji. Somehow we are forming a group. Today you are sitting in Pune, but originally you are sitting in Uttarakhand. I am sitting here in UK, Rajan ji in Mumbai, Sharma ji in Bhopal, and look at today we have Priya ji joining from Kollam, and Anuradha joining from Trichy, and from Jorhat, Nilakshi ji is joining from Jorhat, Doma ji joining from Telangana, so West Bengal. So there is something that is happening.
This is a good idea.
We will make it happen, ji. Thank you. And this integration will go forward. Whether I'm hoping that our friends in Pune will.
Thank you, sir. Thank you.
Will also, together with Agnihotri's guidance, now his daughter is there, so he will be visiting Pune more frequently.
Sure, sir.
Shubhratri.
Again Shubhratri.
Agnihotri ji.
Ji sir. Namaskar, sir. Namaskar.
For a little while, can I draw your attention?
Oh, sure.
If anything hemorrhage occurred.
There was a doubtiness and now it is ward off. So you can please.
Pardon. Whenever there is hemorrhage in Vamana karma, then I heard that our Sharma ji was telling that some Avipatikar churna with ice.
Ice cream.
Ice cream is mixed. It will be controlling. I don't think that ice is required. If it is added with tender coconut water, it will be more effective. And another thing is this, only to add tender coconut water to Avipatikara Churna. But combination of this side, where there is hemorrhage during Vamana Kriya, then the Mayura Chandrika Bhasma with Kaharva Pisti, it will be more supportable, and it will be more according to therapy also.
Domaji, are both these Rasaushadis, are they manufactured?
These are not Rasaushadis. These are not Rasaushadis. They are Bhasma, Mayura Chandrika Bhasma. Peacock Bhasma. Peacock Bhasma and Kaharva Pisti. Kaharva means Trina Kanta Mani. Krinakantamani,
Is it
Bhasma. Both are
the-
mixed in a proper way, because it also controls a phlegmatic condition if these served Mayurachandrika Bhasma. And in addition to that, it's a costly one that serving Mauktika Bhasma with that means butter with butter, Mauktika Bhasma with butter. That also controls.
सर
During
ये
Vamana karma, if anything hemorrhage happens.
आइसक्रीम वाला जो कंसेप्ट था सर, इट इज बाय चांस, शहद नहीं मिल रहा था तो हमें आइसक्रीम मिल गई, चटा दिया उसको।
हाँ, कोल्ड के नाम से वासो कॉन्स्ट्रिक्शन तो करेगा ही।
बिल्कुल बिल्कुल जी बिल्कुल।
थोड़ा एंटी हेमरेजिक करेगा, थोड़ा वासो कॉन्स्ट्रिक्शन करेगा।
इमीडिएट रिस्पॉन्स आया सर, पेशेंट को इमीडिएट आया। चलिए सर, ये सब अपन करते रहेंगे और जो भी अच्छे से अच्छा प्रयास है वो करना चाहिए, सबको अपना अपना कंट्रीब्यूशन के साथ में।
जी
हमारा एक प्रयास हो कि हम एक अच्छा क्लिनिकली अप्लाइड आयुर्वेद प्रस्तुत करें छात्रों के सामने, छात्रों को उसमें कॉन्फिडेंस हो, विश्वास हो कि हमने किया है वो सही है, उसमें क्लासिकली बेस्ड है, उसमें कोई वो नहीं।
थैंक यू सर, थैंक यू सर।
Very good night. Good night to everybody. Sharma ji बहुत बहुत धन्यवाद। Good night.
Good night.
Good night. Pavan ji good night. Doma ji शुभ रात्रि।